Mindful that we have a very full and rich agenda today for our 8th annual Sequential Intercept Model meeting and annual conference. So I'm going to go ahead and get us kicked off with a welcome and introduction. It's such a pleasure to have all of you here today. I'm just so overwhelmed with excitement to be able to welcome you to the 8th annual Sequential Intercept Model Conference hosted by Midshore Behavioral Health. My name is Katie Dilley, and I have the pleasure to serve as the Executive Director of Midshore Behavioral Health and be with an absolutely amazing team that are here today supporting and bringing this conference to you. It's just, I'm just, like I said, full of gratitude as we welcome this 8th annual conference and this new virtual platform. This is our second year doing the conference virtually. And this year I'm just excited to bring a whole new look to the conference with our BFairs platform. And it's just exciting to be able to gather with this many of you and partners regionally here on the Eastern Shore and Midshore of Maryland, but as well with lots of partners across the state. So it's just an honor to bring this opportunity to gather here today. After I go through a brief welcome and a little history about the Sequential Intercept Model and how it's brought so much strength to this region here on the Eastern Shore, we will be going over quite a bit of housekeeping items and how to navigate the day so you feel very comfortable and prepared to have the most fulfilling experience today on the conference. So just a little history for those of you that might be joining us for the first time, welcome. But just a little history on Midshore Behavioral Health's role and relationship with the Sequential Intercept Model. So we started back in August of 2014 with an application that Midshore Behavioral Health put in for a grant with the Gaines Institute with SAMHSA. And SAMHSA is the Substance Abuse and Mental Health Services Administration. And for those of you who aren't familiar with the Gaines Institute, it's an acronym for Gather, Assess, Integrate, Network, and Stimulate. So the Sequential Intercept Model details how individuals with mental health and substance use disorders encounter and move through the criminal justice system. The SIM model helps communities identify resources and gaps in services at each intercept and develop local strategic action plans. So the SIM mapping process actually begins with gathering leaders and stakeholders from different agencies that represent each of those intercepts to work together to identify strategies to help assist with diverting individuals, specifically with mental health and substance use disorders, away from the criminal justice system and into treatment and community supports. The SIM also supports identifying gaps in services in the region, and we've used the model now going on 8 years to help do that here in the Midshore region and on the Eastern Shore to look at our services and resources that we need to grow and seek out. So back in 2014, our cross-section of leadership that was involved represented behavioral health, the judiciary system, our criminal justice systems partners, and community stakeholders. We gathered for the first time to assess our region and actually map out the services and gaps here in the Midshore region in relation to how we could look to divert individuals with behavioral health issues from the criminal justice system. At the first gathering, our members of the Gaines Institute that came down from SAMHSA guided us through this process and helped map out our resources and gaps at various points of each of the intercepts, from pre-arrest to entry, all the way through to parole and probation. So together, that group prioritized the most critical areas of need that would be identified for the group to improve it for the region. From this SIM meeting back in 2014, it was agreed upon that the Midshore Behavioral Health Forensic Work Group would be convened to move these identified goals forward, and the larger group of stakeholders would meet annually to review our progress and provide perpetual input to the priorities for continued improvement. So here we are today, 8 years later, gathering again for our annual meeting that has grown into an amazing conference. We've taken this model and really illuminated a lot of different populations and highlighted how different groups can be identified and mapped through using the SIM model as a tool. A couple of those focus areas that we've worked on over the years, and some of you might have been through each of these conferences, and we're glad that you're back and you keep coming back. We have looked at the model through the lens of our child and adolescent population. We've looked at the model and how it impacts individuals that are being human trafficked, as well as looking at our veteran population. And those are just a couple of groups that we've identified as focus areas over the years. So this annual conference is, like I said, an amazing event that brings together regional and state level stakeholders that are serving our communities and are invested in strengthening resources, enriching and establishing partnerships, and identifying our gaps in services, networking, and all of us having a collective interest in building communities that divert individuals from the criminal justice system. So today we are going to be applying the model to look at the application of the model through the lens of race-based trauma and stress. This is an area that the Midshore Behavioral Health team, specifically our forensic mental health program leadership team, with the endorsement of the forensic work group, identified applying the SIM model to address the race-based stress and trauma and the impact of racial disparities and how they play a role in systematic injustice. The focus on race-based stress and trauma has been a topic that since 2020, the team and the leadership here at Midshore Behavioral Health has been in full support of exploring on a deeper level through the lens of the SIM process. So today's conference will move us through 6 intercepts of the SIM framework, with our presenters that are experts in their field and their intercept and represent partnerships to support solutions and growth to address racial disparities in our criminal justice system. And just to highlight, the work here at Midshore Behavioral Health, I will say very proudly that we have actively and intentionally committed to a process to address our role as agents of change to address racism and the impact of social determinants consistently and intentionally in our community and the communities that we serve and the systems that we represent. So this conference today is a wonderful opportunity to do that and collectively commit to address systemic racism and its role in the criminal justice system and how we together can help break those barriers down. So just a little compliment, we've been doing this work here on the Midshore and the Eastern Shore for 8 years, but last year in 2020, Maryland's Public Safety and Judicial Systems Subcommittee gathered and planned for their first statewide SIM conference that was held in November of 2020. There were over 200 participants that joined in that process to get oriented to the SIM model and look at how it can be applied through the entire state. I have to say, we've got about 500 folks that have joined us today to address how it's going to be applied here on the Eastern Shore and take the model back to your communities and enrich the work that you're doing. So I feel that we're really trailblazing and we've done a lot of work around this already. And I'm just very proud that the state is also looking at this model and how it can enrich our system. So I just want to thank you all for joining us today. Want to take a moment to thank the amazing team here at Midshore Behavioral Health. I'm just so grateful for all of my team members and all the leadership that lives here in this organization. It inspires me every day. And I want to give a special thanks to Julie Slivka, our marketing and events coordinator. She's just been absolutely outstanding and been our fearless leader through this process to bring this conference to you today. Our forensic program manager, Alicia Salisbury, our amazing forensic case specialist, Akima Copper, and of course, Kelly Moran, who's the leadership of our administrative department, leading and supporting Julie with her planning. And everyone else that's been involved with all the details. All of us are here today and we'll be supporting different roles throughout the conference. And it really takes all of us to bring this together and make it successful. So I'm just so excited to be here and be a part of this today and watch it unfold and learn from our amazing speakers and all their wisdom that they're going to bring us this morning and into this afternoon. And I do want to extend some gratitude for our Midshore Behavioral Health Board of Directors, as well as our Regional Behavioral Health Advisory Committee here in the Midshore for all your support with continuing to endorse the work that we're doing here at Midshore Behavioral Health. So at this time, as we move through today's conference and have, kind of an tailored and individual experience as you, explore and, especially for those of you who have never been to a SIM conference, it's a nice opportunity to have quick access to resources that can help explain and highlight all the different intercepts and the pieces that we've worked on over the years. And I would definitely suggest checking out the map that we've put together for our region in particular, because there are a lot of great resources and probably several partners that are here participating with us today are referenced on that map. And we're grateful that you're here. So I have the pleasure and honor to introduce our keynote speaker, Mr. William Jernigan. Welcome. We're so excited to have you here today. Just a little background on William. He is a native of Baltimore City and a tireless advocate for children and youth. Mr. Jernigan has provided two decades of exemplary service and leadership while working in various roles within the state and local governments, community-based and nonprofit organizations, healthcare systems, and more. Currently, Mr. Jernigan serves as Maryland's statewide Racial and Ethnic Disparities Coordinator and the Director of Youth Prevention Services with the Children and Youth Division of the Governor's Office of Crime Prevention, Youth and Victim Services. Wow, that's just awesome and outstanding. Just very proud that you're here. In these roles, he plans and coordinates statewide efforts to improve outcomes for Maryland's children and youth, reduce child welfare and juvenile justice system involvement, and combat the overrepresentation of youth of color in Maryland's juvenile justice system. Mr. Jernigan is currently in his second term, serving as the National Racial and Ethnic Disparities Coordinator and Representative with the Coalition for Juvenile Justice, a national organization committed to the improvement of the country's juvenile justice system and creating a more just and equitable outcome for all youth and children who are involved or at risk of becoming involved in the system. In November of 2021, Mr. Jernigan was named the recipient of the CJJ's National Andrew Smith Award, which recognizes a racial and ethnic disparities coordinator who has made outstanding contributions to the elimination of racial and ethnic disparities in the juvenile justice system. Well, congratulations, Mr. Jernigan. It is quite an honor for you to share your time with us today and all that you bring to the community and obviously nationally in your leadership and your wisdom and your expertise and your advocacy. So it is our pleasure to have you here. We are truly grateful. And Mr. Jernigan is going to be presenting on disproportionate system involvement. So at this time, it is with great pleasure that I hand it over to William.
Good morning, and thank you for the introduction, Katie, and also more importantly, thank you for allowing me to participate in such a intentional and wonderful event. If I was not going to be allowed to serve as the speaker, I would have been an attendee in today's event. So I just definitely want to tell you thank you for not just putting this together, but even bringing together a collaborative of partners and stakeholders who are all working to improve outcomes for all the people on the Eastern Shore and throughout Maryland. So I just thank you for that. I also want to give thanks to the entire executive team of Midshore Behavioral Health, the staff, and even the community for even allowing me to be in this space. It's a pleasure and an honor. And even with all of those things that was actually mentioned in the introduction, I would definitely say one thing that I didn't mention is that I actually serve as Maryland's as a ACEs master's trainer, should I say. I'm here in the state of Maryland and looking at the correlation between system involvement and even adverse childhood experiences and how those things are interconnected, not just here in the state of Maryland, in my opinion, across the country. So I definitely wanted to share a few slides with you all, but I definitely, before I even share those slides, just definitely want to tell you a little bit about my passion and my reasoning behind the work that I do. Actually, as you mentioned, I actually serve as Maryland statewide racial and ethnic disparities coordinator and even the director of prevention strategies. But ultimately, those roles are centered around my passions and beliefs about our young people, the next generation, understanding that not just in the state of Maryland, but across this country. I actually serve as the national racial and ethnic disparities coordinator. That I have good news and bad news, everybody. The bad news I start off with first: racial and ethnic disparities do exist. Quite contrary to what some may say or believe, even not just in the state of Maryland, but even if I talk to, for example, in the state of Maryland, the youth who overrepresent our system is African-American youth, specifically African-American males. If I talk to my colleagues out west, it could be African-American specifically, also could be Hispanic in the Hispanic Latino youth population. If I talk to some of my colleagues in the Northwest, who actually are state representatives, it could be the indigenous population. Even in Guam, even in the state of Alaska, disparities are prevalent even in those specific states. So I definitely just wanted to say that, but the good news is we can do something about it. How do we actually work to address those issues? How do we be proactive versus being reactionary to the issues that is faced with our kids? Because ultimately, I'm a wholehearted proponent of prevention, because ultimately the system actually tells us that kids coming into the system, oftentimes the challenges didn't start with those young individuals at that moment when they inserted the system. What was the issues and challenges and barriers that they faced, as resilient as they are, well before they became involved with the system. So I'm going to share a few slides with you all. Thank you again for having me. So once again, that's the title of the presentation. Very quickly, disproportionate system involvement. So ultimately looking at those things, I wanted to tap into a few things, specifically looking at the historical background of racial and ethnic disparities and even the issues that have impacted specifically kids of color throughout the inception of the juvenile justice system and even prior. So ultimately, from a perspective of the juvenile justice system, there are various components where people might look at, okay, we're currently in 2022, but the issues that actually have existed started well beyond even just 20 years ago. Like historically, the system has not been kind to all kids in particular, but specifically children of color have been systemically impacted by the juvenile justice system. Starting beginning with this Parents PA this actually started the first juvenile justice system here in the late 1890s, which actually gave states power and authority over children who was deemed in inadequate situations. And from that point on, in the state of Illinois, the juvenile justice system started, and from that point on, a swath of them grew across the United States. Prior to that, when you're looking at the overall perspective of how kids of color could have specifically been impacted, if you look no further than 1865, the Freedmen Codes, and during that time after the Emancipation of Proclamation, even when free slaves were released from slavery, their children were still kept in those, with that code, still kept within the confinements of being around for apprenticeship programs and things of that nature. But then also, more importantly, unfortunately, during a harsh time of, unfortunate time of our country, the convict leasing experience, which is actually predominantly impacted African-American males. 1890 census was done in the U.S. and during that time, it was deemed that nearly 20% of those who were involved and impacted by convict leasing were actually children. So from that perspective, even well before the inception of the juvenile justice system, there were some challenges before it even started. So the work that I actually do is actually done, performed by the federal guidance. So I actually serve as Maryland statewide racial and ethnic disparities coordinator, but there's typically one of me in each participating state. across the country. So if you look at it from that perspective, the federal guidance, the Office of Juvenile Justice and Delinquency Prevention, it provides states with funding and resources to actually improve the juvenile justice system and allow states to improve outcomes overall for kids. But if you look at the inception of the juvenile justice system, which I told you on the previous slide, it actually started in 1890. You look at the various components of the JJDPA Act, which I have this shot to illustrate what was the components of the act. You notice that at the last bottoms, the last bullets towards the bottom were in 1988. It literally took maybe potentially 100 years almost for emphasis to be put on how things could be done to improve outcomes, specifically for African-American youth, Hispanic, Latino youth, and all youth of color. So the origination of the act started in 1974 and provided by Congress. So the ultimate things that we know that kids come into the system, they can actually be impacted in many ways. But during that time in 1974, Congress understood that there were some challenges as it related to the institutionalization of status offenses. So status offenses, adults, no need to worry. Status offenses are things that if a child did it, they can be impacted, but if an adult did it, it wouldn't be no issue. For example, things as far as like being truant, which is having challenges within school, possession of tobacco, incorrigible behavior. So all these different things where it's deemed like low-level or minor offenses that if an adult did it, it's not an issue. But if a kid did it, they could be formally charged within the system. So they started looking at that point and saying, okay, 1974, we have a challenge. 1974 also separation, which is actually keeping youth from sight and sound separation away from adult contact when they come into the system. Unfortunately, we all know that when kids do come into the system, there has been challenges where they could have been abused or impacted in many ways. And even have some very unfortunate situations in that regard. So the goal was just to put a safeguard on protecting children, which is actually what the sole purpose of the act was. But even jail removal, synonymous with separation, it actually was incorporating the 6-hour rule. So if a youth is not going to be formally charged, meaning they're not going to have a long-term stay, that they should be removed within a 6-hour time frame and reduce challenges. So racial and ethnic disparities came up, but before it actually became racial and ethnic disparities, it was disproportionate minority confinement. And Congress at that time understood that there was issues at the point of confinement. That means the last point of the juvenile justice system. So they were being dismissive at the time of what are the challenges at the front end and also towards the middle as it relates to diversion and so forth. But the sole focus during that time was confinement. It took 14 years later that they actually realized that, hey, there's some challenges, not just at confinement for kids of color. There's challenges in all facets of the juvenile justice system. So basically, they noticed at that time that they were arrested more, diverted less, and even having different issues as it relates to confinement as well. Racial and ethnic disparities was actually made states take a deeper dive. So actually I had to provide an actual plan to the OJJDP to actually illustrate our willingness to divert kids to improve outcomes, to develop a plan that's very comprehensive. It's actually a public document that you can actually review. It's actually on our website, but it's definitely allows states to take a deeper dive and even taking a stance on how to really be strategic about data collection and addressing racial ethnic disparities. So disproportionate data, I wanted to definitely take a look at that for you all to give you all the insight. Very, very quickly before I jump into some national and even some statewide data, globally, the United States has actually been deemed as having one of the most punitive justice systems for young people. So if you want to look at it from this perspective, the whole pie is actually a document that's actually put out annually by the Prison Policy Initiative. So they have a report that recently came out, but they are synonymous pretty much around the same levels of numbers. But this one in 2020 reported that 52,000 youth in the United States were confined in facilities. That's like 52,000 kids across this country. And also, it also mentions what gets to the, provides more clarity to the instance, because oftentimes when people hear the word juvenile justice system, you think that something severe or extreme has happened. When you look at it, not just here across the country, the multitude of cases that are in the juvenile justice system are not for extreme or severe cases. They're for repeat offenders, for minor offenses or mid-level offenses. And we're trying to utilize this system to correct behavior, which has definitely historically told us that it's not even humanly possible to do so. So from that perspective, just to turn this back over to the slides here, 6,600 youth were confined for technical violations of their probation, which means that once they came in, they had challenges, okay? But then also more importantly, it says that rather than new offenses. So these were kids who came in and ultimately they probably didn't have the certain structures or supports that they needed. But then they also eventually came back, which we all know that recidivism rates is even as a high issue for the juvenile justice system with national data centers. Sometimes kids who come in, they eventually sometimes 3 to 4 times more likely to return. So also additionally back to that, the status offenses that I mentioned earlier, during that time, 1,700 youth were locked up for those status offenses, which was, again, those offenses that if adult did that offense, it wouldn't be an issue. They wouldn't even get a slap on the wrist. But if a child or youth did it, they're actually going to get formally charged to the system. So national data, very quickly, youth of color overrepresent every aspect of the juvenile justice system. Also specifically, African-American youth represent 16% of the total youth population, but they represent 40% of the system and facilities across the country. And even at the local and state level, Latino youth, the data tells us is incarcerated nearly twice as often as white youth. And the caveat to all of that, which goes back to the historical part and even the misrepresentation and the challenges, if you look at it from that perspective, research shows that youth of color are treated more harshly, even when they commit the same category of offenses. So ultimately, we have issues across the country where 2 kids might commit, unfortunately, the same offense, but have 2 totally different outcomes. And that's not just an issue that is something that I might have had on a one-off discussion, but we had national conferences, things of that nature. States talk about how those things are actually prevalent even within their states. So I'm going to share some data with you all. This data that I'm sharing with you all is our statewide referral data here in the state of Maryland. Ultimately, the first that you can see up here that I want you guys to pay attention to really quickly. I'm sorry, I had something in the way of my slides. I want you to pay attention ultimately to this statewide data. Off to the right, you'll see that there's a pie chart there, and that chart is our actual census data as it relates for 11 to 17-year-olds in the state of Maryland. And so you'll see that ultimately you can see that youth of color specifically overrepresent the referral numbers that's coming in the state of Maryland. Specifically, it has significantly decreased to some degree. From FY 2019 up at the top, you see that Black youth was 61%. And then this past fiscal year, there was 57.9%. But the one thing that I want you to actually focus on here is that if you look at the pie chart, you can see that Black youth were 31% of the total youth population, but they're nearly doubled as it relates to the kids who are referred to the system. But even those numbers are still significant, even with the extreme decline in complaints that's coming into the juvenile justice system. So you can see, which has been going on in the state of Maryland, you can see that nearly 19,000 youth came in, were referred in 2019. Down to FY21, down to just around 7,000 youth. So you can see even with those declines that there's still a stark representation of Black youth coming in for referrals. Baltimore City is actually a city that oftentimes people, even across the country, people say, William, what does the data look like in Baltimore City? But in those populations, specifically where there's a high representation of specifically of people of color, the numbers actually represent what you see. But with the one thing that I want to tell people ultimately is that if you're looking at disparities, don't just always look ultimately where you believe there's a high representation of people. It's all about outcomes. So that what I wanted to share with you very quickly before I move on to the next county, but you can see that there's a high representation of our Black youth, specifically African-American Black youth, Black males in Baltimore City being referred for the system. So when I talked about the outcomes and that it relates to the representation of a specific county, this is Baltimore County's data. So you can see that there's a lower percentage compared to Baltimore City of Black youth. They were 70+% in Baltimore City, but they're only 34% of the youth in this specific county. And then when you look at it from that number, the representation is still high. So you see that there's 72%, which is actually a decline was nearly 80 2 years ago. But you can see that there's a high representation, and even still with the significant reductions down there at the bottom, where you can see from nearly 3,500 down to just like 1,300 over the last fiscal year. Montgomery County, a county where there's a higher representation of Hispanic Latino youth in the county, and you can definitely see this data set illustrates that. You see that there's a higher representation in comparison to what I showed you at the 2 previous slides of a Hispanic youth population coming in, but then even the Black youth over that, for example. But you can see even with this, the stark declines, there's still a significant representation, which those numbers are not as stark as the previous ones. What I definitely wanted to do was just show you a couple of instances of like what the big 5 may potentially look at, but just definitely don't want to go through all of it, but just to give you a glimpse. But I also wanted to give you a representation of Maryland's Eastern Shore. So ultimately, before I go any further, in the middle of this slide specifically, you'll see Some numbers there, you see like Caroline County, Cecil County, Dorchester County, Kent County, and that chart in the middle, that's actually relevant because it's relative rate index data, which is actually no longer required to be used by the federal guidance. They're now requiring states to actually utilize census data and compare it to the number of kids being impacted. I'm totally against that, because if you use the data from the census data and you calculate it to the number, for example, if I calculate the number of kids who have been impacted by the juvenile justice system in comparison to the 500 or so youth in the state, if I calculate that number, it's going to give me a very minute number, somewhere down around like 1%. So it's not really going to give the illustration of what the real severe challenge is. And so I definitely we still utilize relative rate index data, which actually gives us an opportunity to look at what are some of those severe challenges in our system. So the numbers you see right there in the middle, that if you see the number, for example, 3.13 for Caroline County, that means that in that county, at the front end of the juvenile justice system, youth of color are 3 times more likely to be referred in that county in comparison to white youth. So you go down Dorchester, 4.5. So kids of color are 4.5 times more likely to be referred to the juvenile justice system in that county. And you can see that number as a representation going down. But overall, you can see that some of the glaring things that jumps out in this slide, Black youth are 20% of the total youth population between 11 and 17 on Maryland Eastern Shore, but they're 50% of the kids last fiscal year of the kids who are coming in, and so forth. So I know you all can see that, but I definitely wanted to take the time to go and look at a couple of local counties. Caroline County as well, 14% of Black youth representation in the county, but 53%. And you can see that there has been a stark increase from 38 to 46 to 53% in that county over the last 3 fiscal years. But you also can see that there's been a significant decrease as it relates to kids overall coming in at the bottom. Dorchester County, Black youth are 36% of the total youth population, but they're 81% last fiscal year of those kids that's actually coming in Dorchester County. Queen Anne's County, Black youth are 5.2% of the youth population, but they're 35% of the kids that were actually referred to the juvenile justice system. Wicomico County, you can see that there's Black youth are 29%, but double that number and more when you look at the representation for referrals to the juvenile justice system. So ultimately, just wanted to share some of this data with you because ultimately, not just the point of just a point the finger kind of thing. It's not a challenge as it relates to one specific entity or one specific stakeholder. I believe that this is a collaborative, because kids who are referred to the juvenile justice system have multifaceted problems. They might have challenges. I know myself, one of the things I do when I actually do presentations, specifically in an in-person space, every time I do a presentation, I ask every individual in the meeting or the session to raise their hand if they did anything wrong or unfortunate at the age of 18 or under. And oftentimes, regardless of the demographic, regardless of their race, those individuals ultimately somewhere around 80% of the room raise their hands. And so ultimately, we look at it from this perspective, like we all have made mistakes, we all had done certain things, and we had to look at it from that perspective, is that are we really doing our best by, preventing kids from coming into the juvenile justice system, and what kind of structures and supports can we put in place versus taking kids to have a deeper dive within the juvenile justice system. So this data that I'm sharing with you right now, statewide secure detention data, and you can see from that, this is very significant as it relates to the representation of Black youth. They actually dominate the detention data here in the state of Maryland. So definitely just wanted to share with this, because ultimately, as I mentioned, the act before looked at confinement and being held in facilities, but then really take a strong emphasis on the front end, which we're actually focused on here from a preventative standpoint. So disproportionate data in other systems. Also, not sure if you are familiar with the crossover pandemic that was going on across the country, epidemic, should I say. The issue with that is that there are issues that are packed, like could actually increase the likelihood for systems to be working with both kids. For nearly a decade, I worked in the child welfare system at the Child Protective Services level and the Ready by 21 level, keeping kids safe at the front end of the system, but then more importantly, transitioning kids from the foster care system around the time that they was 21 and being emancipated from the system, making sure that they have all of the things that they need, housing, health, all these different things, employment was in place. That way they can live some productive lives afterwards. And what I would definitely say is that some of the stark differences that you would actually see is that actually in the placement data. So years prior, if I know we're sharing this data point, and so for those who I didn't get a chance to share, there's a lot that takes place. And so oftentimes when we look at these slides, there's a lot of numbers and things that's flashing in front of us. But I remember definitely over my years working in the juvenile, working with kids who were justice involved, juvenile justice, and even child welfare system involved. One of the biggest challenges was seeing that data, in front of you. So it's not I'm looking at a piece of paper, but going into a facility and you see a high representation of kids, it makes you think, it makes you understand like what is really going on, what's the why, and how do we get to this point? So which actually gave me a little bit more passion, obviously, to do the work that I do and being passionate about it. But as you can see, just at the child welfare, that the juvenile justice, there's challenges as it relates to the child welfare system data. This is placement data here in the state of Maryland. So you see that Black youth are 33% of the total youth population, but that 54% of the youth actually placed in out-of-home placements, like being placed in the foster care system and so forth. So ultimately, you can see the representation that goes on for the next demographics. So you see white youth, 44%, 29% of placements, and even Hispanic youth, 16%, and 16% of the population was 7% of those actually placed in foster care placements during the fiscal year. The school to prison pipeline. Now, one of the biggest things that we actually talk about is how the kids get into the system, but the school to prison pipeline is definitely a huge dynamic, not just nationally. Even here in the state of Maryland, I know that Governor Hogan actually instituted a commission to look at this dynamic here in the state of Maryland. But more importantly, what I would definitely say is that I think that it's much larger than the school to prison pipeline. I believe that ultimately it's the community to the school to the prison pipeline. So it's like, what are those systemic pressures? What are those structures? What are those issues that's actually impacting our young people that actually allows them to come into a school system that potentially can be punitive and very and it's no strike against those who work in the school system. It's just in general that kids can eventually come into the school system and potentially not have certain guards and things put up in place, and they actually can be faced with various issues as it relates to being suspended and expelled at a higher rate. I too, as I'm standing here as the speaker of the opening speaker, I too actually went from a grade A student, a A+ student, throughout my tenure leading up to high school. 9th grade did exceptionally well, but my 10th grade year, unfortunately, due to a whole host of dynamics and things that I was faced with, as a young person, I actually was expelled from school. And so someone might look and be like, William, how did you get expelled from school? It wasn't necessarily things that I have done. It was a lot of things that actually relate to some various contributing factors that we're going to talk about next that I was faced with that culminated in that. So, but whenever things came to the head, I came to the table. No one asked me what the contributing factors were. No one asked me what were some of the things I was faced. No one asked me about what were some of the things that was going on in my particular my life at that time. But the issue was you didn't perform or you didn't do what you need to do, and as a result, I was expelled. So contributing factors, very quickly: economically disadvantaged and unstable communities and neighborhoods, low performing academic institutions, specifically public schools, delinquent peers, negative peer influence. I would definitely add a little note to that. I definitely, as I mentioned, I grew up in Baltimore City. I grew up in the western side of the city, West Baltimore. And I would definitely say that bullet in the middle throws me a little bit every time I look at it, because ultimately I believe that if kids are afforded with specific opportunities and structures in place, they would definitely do some things that definitely would shock a lot of people. I've definitely ran youth programming with some of the young people in Baltimore City who people might frown upon and say, William, oh, that young person is not going to do well in the program. Even the person who referred the kid didn't present me with the most hope when they referred that young person. But what they didn't know is that after a while, when the kid was supported, these kids excelled. And not only did they excel, they actually turned out into even still now to this day doing some very productive things, leading nonprofit organizations, working in jobs where they're doing like some very high level work. Some of them even make, one of them particularly I know of, he actually makes more money than I do. But when I met him when he was 16 years old, everyone was frowning upon him. So if kids are not afforded opportunities, I know that when I grew up, actually in the middle of my teen years, I remember my local library closed and 2 of the 3 in the 90s, 2 of the 3 recreational centers in the walking distance of my home actually closed. So I watched kids who was actually in those spaces on a daily basis who were doing extremely well, doing great things, that once those resources were pulled away from them, all of a sudden I started hearing what was Montrose, what was Boys Village, which is now Cheltenham. I started hearing all the names of these juvenile justice facilities. And previously, these kids were excelling and doing well in their communities and at school. So once those kids were stripped of those things, then all of a sudden the peer influence and all those things I started seeing picking up. But it's like, how do we actually afford kids an opportunity for growth and positive development when we pull in resources from them? Our family resources, family risk factors, I'm sorry, those are huge dynamics to how kids can, be impacted and be, unfortunately, increase the likelihood for them to be infused in the juvenile justice system. But lastly, greater exposure to violence, which is also identified in this federal research. Other things that I would add to it, the impact of trauma is so huge. Looking at trauma, SAMHSA actually, as you read the quote there, SAMHSA actually had this quote there: trauma is defined as a lasting response, not a temporary, but a lasting response to experiences or circumstances that exceed an individual's ability to cope and produces lasting adverse effects. So oftentimes when we talk about what's the impact of trauma, sometimes that we see that young people go through things. I know that for my professional experience has allowed me to work with various populations. I work with system-involved youth. I worked in developed youth programs, but I also work with adults. Oftentimes when I work with those adults, whatever their challenges were, people would think that, oh, this adult did something and it just didn't make no sense. When I sat down and did an assessment and we talked with the individual before we got them situated, for example, I could be working with a 50-year-old and someone like, oh, he did something when he was 50 years old. Whenever I got to the crux of what was going on, every single time that when I talked to that adult, when I asked them at what point did things go wrong in their life, they didn't say 5 years ago. They will ultimately say, when I was a child, I was faced with this. When I was a teen, I was faced with this. And so it puts things in perspective, like what are those challenges and things that happen before someone's 18-year-old benchmark? And those things actually are identified as average child experiences, which I'm gonna talk about next. But specifically on this slide right here, what I wanted to actually tap into before I go to the next one, you can see that I highlighted there a portion of the brain, which is called the amygdala. So the amygdala actually serves as the early warning sign to alert an individual of fear or challenges or adversity. So imagine an English guard. The English guard, the guy that's standing there with the red jacket, the tall black hat, he's standing at the fence. That's the portion, that's the opportunity that presents for our brains. So if you see that, oftentimes, have you ever heard of the term fight, flight, or freeze? So when you hear fight, flight, or freeze, oftentimes that's actually the portion that actually allows us to be able to identify threats or adversities or challenges. So if you look at it, imagine the difference between a child who didn't have so many different barriers and challenges going on, but imagine a child who was exposed to various ills, traumas, and various things that was actually impactful for them. Their ability to normalize dysfunction is definitely going to increase the likelihood for them to potentially have some challenges down the road, like behavior-wise. So it's not that they're really specifically doing sometimes things that's out of whack. It's that their brains is working the way that it was designed. So if you was emotionally abused or faced with traumas and uncertainty, physically abused, all these different things that youth are potentially impacted by, their brain is actually responding to past behaviors and experiences. So average child experiences, what I definitely wanted to do was tap into this very briefly. So if you want to look at this, you can see that the ACEs realm, not sure if you are familiar with slides of the ACEs, and the pyramid is definitely something that always come up. But the most recent information it shares, like what are the different contributing factors that lead to average child experiences, beyond just looking at it. So just to give more context, the original study actually happened in the 1990s, and the location was San Diego, California. It was provided by some very esteemed researchers, Bob Ander and Dr. Vince Validi of the CDC and Kaiser Permanente. And during that time, they were looking at the San Diego population, which was a high representation of the middle class. Here in America, they had some of the best healthcare that the country had to offer at that time. It was mostly middle class whites or white Americans who was participating in the study. And during that study, when they actually did this particular, when they did the actual study, they realized that there was a lot of adversity that individuals had faced well before their 18-year-old birthday. So they were faced with physical abuse, sexual abuse, divorce, various things that impacted them. And those things, if they're unaddressed, which is actually the significance of the science, if those issues are not addressed, they can lead to health challenges and risks moving forward, which for example, like social, emotional, cognitive impairment. Unfortunately, it can lead to disease and things of that nature if they're unaddressed, but unfortunately, it can even lead to early death. But one of the things we look at average child experience is like, what are the drivers? So under the soil, which you can see on the 3 realms of ACEs, picture, you can see that historical trauma, substandard schools, a lot of the things that you see right there is the same factors that actually lead kids into the juvenile justice system, for what the research tells us. Violence, poverty, which is actually low socioeconomics on the stats, structural racism, I know, which is definitely an issue as it relates to our current climate, but then even the historical context as well. So just looking at it from that perspective, like what are some of those things that's actually going on, even currently, even still within our time? The city of Philadelphia even did a deeper dive into it and looking at how adverse experiences and even to expound upon that, microaggressions, implicit bias, and all these different things, how they actually impact people and communities of colors, and how that actually leads to more challenges for them down the road. So I definitely encourage you all to look a little bit deeper into this, even well beyond today's events. The impact of bias on the justice system. The messaging to alert, and I guess provide information here, even in the US is definitely sometimes have been unfortunate, meaning that if you can see here, we have literature here, the rise of the super predator and the decline of the rehabilitative ideal. I'm not sure if some of you have heard of the impact that has been on not just on Black youth, but even Hispanic, Latino youth, when they was actually coming here, when the parents was a part of the Bracero programs and things of that nature out west. How they was deemed feeble-minded and not able to be rehabilitated and so forth. The super predator narrative definitely took a place in the height of the 90s here in the US, and how those biases and things of that nature, the messaging actually treated like led to kids of color being mistreated, even specifically misrepresented in the juvenile justice system. What I wanted to share with that, even still then during the super narrative time, you see that it was a high crime, well, not high crime, but high total arrest for youth in general, all youth who were coming into the juvenile justice system, somewhere over 2.5 million during the time around 1995. But you can see since then, there's been a stark decrease. But however, even still now in our current time, you still see some messaging that's, for me, that's a little bit concerning, regardless of the behavior. When you start seeing specific things, that you might see something that happened in the news, you might say teens did something at a mall. Now you're starting to see those narratives come back with juveniles. You start saying juveniles. And anyone who ever heard me do a presentation or talk in general, I try to my best to shy away from saying juveniles. I will never call kids juvenile. I'll call them youth. Youth who unfortunately come into the juvenile justice system is what you will hear me say. So when you start giving that term out, it gives a connotation that connects them to the system within itself and actually victimizes potentially those behaviors, which we know ultimately all the kids who are coming in for the juvenile justice system are not kids who are doing high extreme things. It's kids who are coming in for mid to low level offenses. So coming to the end, how do we fix this issue? I have 2 pictures up there very vividly just for opportunities. Sometimes it can be a puzzle. How do we address these things? How do we plan to coordinate these efforts? But I believe the biggest thing is to be, for my opinion, as a national coordinator, which I share with states, is be very intentional at the front end. Trying to fix issues as it relates to confinement or detention for the young people. It's not that it's too late, but it's a lot of the challenges that kids are facing is well upstream. So are we actually focusing on prevention? Because prevention is the best thing that we can do to keep kids from coming into the system. So instead of ultimately being focused on reforming the system, what are your efforts at the front end? That's what we're focused on, and that's been my narrative since I arrived. Are you providing opportunities for early intervention programs? Our JJAG funding here in the state of Maryland provides diversion programming, youth development programs, and various opportunities at the front end for young people, specifically at that early age stage. And ultimately, our local management boards, as you all know, provides a lot of context and supports for resources, should I say, for the local the local counties here in the state of Maryland, but also racial and ethnic disparities is now one of the priorities of those funding, which is around $20 million annually. And so looking at those kind of perspectives, and even average child experiences, reducing average child experience is also a very important priority as well. But Project Bounce Back, I'm not sure if you are familiar with a recent, Governor Hogan actually committed $25 million for young people actually who attend Title I schools and even the rural school districts that provide them youth development opportunities in an early space, especially where we are in the height of the pandemic, where there's so many challenges and adversities going on. And even though we have so many different abilities to provide resource to kids, sometimes those resources can be more reactionary versus proactive. So this will be a huge preventative component to commit that amount of funding to make sure that kids have structured youth programming. I've definitely seen this this initiative put youth programming in communities where there was none beforehand. So to see those things develop and to go up and see these spaces and see the kids smiling and see these kids happy, understanding that there's some supports and services in their specific county, there's like words cannot express like the joy in that. So are we being preventative and providing those opportunities? Are we diverting kids? Diverting kids, not saying you divert a kid who did something extreme. Are you diverting kids with these mid to low level offenses? Not just to divert them to say, oh, turn them away. Are we connecting them to the right resources and support services with that diversion opportunity to make sure that they come and have a productive follow-up thereafter? And I think that's the benefit of those programs. Training and technical assistance, what we're doing today, I know coming up on my time, I'm definitely going to breeze through, but training and technical assistance, exactly what we're doing today. But also I would definitely say that even with the whole aspect of awareness, we also have to apply action afterwards. So it's like not just have the talk, but after we finish, how are we going to structurally figure out what are some of the challenges within our organizations, within our agencies? How are we going to address those issues of bias? Are we going to address cultural competency issues? Are we going to address the real issues of what this conference is about? The SIMS, are we really going to look at, is this thing really behavior related? And are we really trying to utilize the system to put out fires that it's not possibly able to do so? So system change, which is actually a big, long reach about how we're going to improve systems, with a lot of reform efforts, but I definitely will stop there with the essence of saying, removing the fence. How are we going to remove this fence? The goal for us is not to, in my opinion, is not to make adjustments, more so than how do we actually do the aspect of just liberation, removing the fence. We know the ultimate barriers and the challenges that are facing our kids across the country. And if we continue to operate in a reactionary component, we'll continuously do what the juvenile justice system has done historically, which is actually not really served our kids in the most equitable and best manner possible. So I wanted to finish up by definitely telling you all, thank you for having me in this space. And I'm sorry if I went over my time, but I just want to tell you I wholeheartedly appreciate this opportunity and just look forward to the rest of today's event.
Thank you so much, William, for that awesome presentation. It's my pleasure to introduce for Intercept Zero, Ms. Doncella Wilson. She holds a Master of Social Work degree with over 20 years experience in the human services profession. Currently, she is co-founder of Manery's Dream Alliance, where she serves as executive director. The mission of Manery's Dream Alliance is to transform the lives of youth, families, and communities through education, resource development, and community engagement. She was elected in 2017 to serve as a council member on the Town Council in Denton, Maryland. She volunteers her time on various local and state boards. She was appointed by Governor Hogan to serve on the Uninsured Employers Fund Board in 2019, and most recently was appointed to the Commission on Trauma-Informed Care. Doncella seeks to live her life as the Maya Angelou quote encourages: when you learn, teach; when you get, give. Please help me give a warm welcome to Doncella Wilson, whose presentation title is Infusing Trauma-Sensitive Approaches in Youth Development Programs. And if I can add, if we are going to just trim some of those break times to allow for speakers to have the time that they need. Thank you so much.
One second to get the PowerPoint back up and going. Wanted to start with this slide here. All right, good morning, everyone. Mr. Jernigan has everything flowing and got us really going in a great direction for a setup for today to be able to present on this. It's a heavy topic for me, the race-based stress and trauma and the impact of racial disparities. And I say this topic is heavy because it really allowed me some time to self-reflect over that last couple decades that was just discussed about my experience in human services, and really personally look at the effects that it's had, that impact of race-based stress and trauma, on what it has had on me personally and family members, and the why to me doing this work. And as William talked about, just really having that passion for better outcomes for our youth and our families and in communities. I also want to preference that for my Black body people in the audience today, this information may be triggering, and just want to set that in the forefront as we go through the day and you hear the different stories from the different presenters. I've been fortunate enough to have the different presenters on site, as you see in some of the pictures that are showing now, and just knowing their stories and that information. So if you just need to take the time to breathe, to get a sip of water, just to do that, step away, but come back quickly so you don't miss anything or miss a beat for this training today. My why, I have a 23-year-old son. And one of the things, when he leaves this house, I am ever fearful of what he will be experienced to out in the community. And it is a real, true fear of anxiety, of just not knowing when someone will deem his presence no longer acceptable for him. And so he knows that if I reach out to him with 10 minutes is too much of a time frame that he cannot respond. If I say, "Where are you?" that he needs to respond. And that fear is real, and it lives every day. And it's not some of the time, it's all of the time that I have that fear. Another why for me is, just as Mr. Jernigan talked about the data sets and how Black boys, Black girls are always at the more or the less end of those data sets. The Black boys are more likely to experience more instances of racism. The Black boys are more set up to live in poverty. That Black boys are more seen in society as people that has really, how society has really taught us to be scared of Black boys, whether it's social or implicit bias that has given us this mindset. If it's the media and how Black boys and Black girls are portrayed in this system. And so for me, we talk about the preventative programs, and that's what you see on the screen now, just a continuation of my why. In the left, you do see Mr. William Jernigan. He attended an African-American boys conference that myself and other partners across the Eastern Shore put on. And this conference is a direct result of the data and looking at the data. And this conference was in 2019. It was held on Salisbury University campus. The conference that we put on is an intentional conference that's held in the middle of the summer. It's held in July on a college campus from Thursday to a Sunday. African-American boys are brought onto the campus, and only African-American men are in front of them during this time, that they are presenting on different items. As you see, Mr. Jernigan, he talked to the youth about racial and ethnic disparities and how they can avoid some of these system failures. And we give them this information, and the boys picture here at the time are between the ages of 14 and 16. So we're giving them this information. We're not hiding this information because society won't allow them to hide. And so we want to make sure that they have this information with them, and we're giving them the facts, and we're not sugarcoating anything for them. What you will see on the right side are the young men that kept coming back to each conference. We tell them this conference it's not set up to be fun. It's not a football camp, basketball camp. It's so they can get information for better outcomes into society. And so I just wanted to share that as a part of my why. Going into the nonprofit Menary's Dream Alliance, and as we talk about the Intercept Zero and community services and prevention, is one of the purposes for Menary's Dream Alliance. As you can see, our mission there, and as it was read, to transform the lives of youth, families, and communities through education, resource development, and community engagement. And so the title of my presentation today is Infusing Trauma-Sensitive Approaches in Youth Development Programs. And so William talked about that prevention and not so much looking for that cure, that we have to have the preventative measures in place to divert our youth in the communities from the juvenile justice system and later in the adult systems. And so I added still a piece of personal information. Don't like to share a lot of personal information all the time. You want to give the facts, but really felt like today's intentional conference was really set up to be able to share that information. As you heard in my bio, all of the activities that I'm able to do, the degrees that I was able to earn, earning 3 degrees, being elected to council, serving on different boards, being appointed statewide to boards, the roles that I play personally as a sister, mother, grandmother, and an African-American female. As some of the old saying goes, to pull yourself up by your bootstrap, in which that saying that we know we don't all have the same opportunity and the same access and acceptance with opportunity. And no matter all from the degrees, from the boards, I still show up in spaces as an African-American female. And so that's 2 strikes against me from just walking into a room a lot of the time. So we carry that, and I carry that into a lot of the spaces that I go into. And it still does not negate any acts of racism. And again, self-reflecting through preparing for this presentation, that there were numerous incidents that I could come up and identify with instances of racism. And one here, the most recent incident for me, and this talks about what happens when your organization, your staff, your board, and your leadership, that we all experience the same race-based stress and trauma. And if anyone has seen in the news, papers, news articles about our organization in the 1.5-year battle that we went through to purchase this property in the site that I'm in currently now. This property is located in Chestertown, Maryland. It sits on 9.5 acres. It sits on the Morgneck Creek, backs to the Morgneck Creek with a permanent pier and a floating pier, and then Morgneck Creek flows into Chester River. This site also has 2 floors, an upstairs and a downstairs. We've completely opened this space up to be able to house our youth programs and our senior programs. This space will allow you to have a safe space to be able to congregate in. But as the slide is saying, but what happens and what has happened over this last 1.5 years? And so I just really listed some comments that came out of some of the people that went kind of through that journey with us during this last 1.5 years. And the main issue was zoning concerns. And for me, it really was racism wrapped up into zoning concerns. We purchased this property from the American Legion, who have been on site for about 40 years now. And so when African Americans, Black people decided that we wanted to purchase this property, we were really met with some resistance, but it was wrapped up in zoning concerns. And as you heard in my bio, I do serve on the town council, have for the last 5 years, so completely have an understanding of zoning, of easements, of the critical path, the right-of-way easements, and to be able to understand that language. So it was brought to us as if we would not understand the language that was given to us. And so just to read one of the comments, there was a local pastor that attended. We had several hearings throughout this time, very late in the evening hearings. Thank you to leadership team from Midshore Behavioral Health, many community partners that were able to come and sit with us during that time. But one of the quotes that I will quote is from one of the pastors. They just said, the last 2 weeks, I've spent 2 very late evenings sitting in the hallway outside the packed council room as the Kent County Planning and Zoning Commission has heard legal testimony and arguments for or against Menary's Dream Alliance buying the American Legion building. And when I talk about that support, and I do, it's a link to his full article that you will be able to access, and sent some information in the full conference portal that you will be able to look at. And then the other information on the slide just really looks at the argument based on zoning for us to not be able to purchase this property. So I want to move on to we have time. I skipped that slide purposefully for just the sake of time, but I wanted to talk about also how trauma during that time and going through this last 1.5 years and how you still have to show up for our community. We still had to show up for our community. We still had to show up for the students that we had in our programs every single day. But every single day, what we were going through was still there and in the forefront of us being able to purchase this property. And this was one of the quotes that I believe completely, I felt going through this process of how trauma compromises our ability to engage with others by replacing patterns of connection with patterns of protection, and believing that this is completely what our youth go through. And when they are faced and have faced with trauma, and they put in patterns of connection and replacing those patterns of connection with patterns of protection. And for us in our programs, when we look at trauma sensitive approaches, we look at the emotional responses to events. Again, these are all personal feelings that I went through over these last year and a half. And while we can say these are general statements, they are, but this is completely how I was feeling during this last year and a half. And people say, are you glad the hearings are over? I know you're glad. And I'm like, yeah, but the wounds are still there. Just knowing that someone did not accept us solely on the color of our skin. And so it was a complete emotional response of headaches, fatigue, difficulty falling asleep, being irritable, nausea, a lot of anxiety. And so our approach to really kind of combat that was to maintain in the community, continue to do our work, continue to offer safe spaces and relationships and caring relationships to our youth and families. And while I appeared in many, many, many meetings with a lot of my colleagues on the line today, and just in showing up, appearing okay and not really being okay. And so moving on to our prevention methods here with Maneri's Dream Alliance in dealing directly with Intercept Zero, rather than simply teaching our students to say no, we want to teach our students to say yes, yes to activity and activism, yes to exploration, yes to collaboration and curiosity, and to leadership and mentors, to the outdoors, knowing their history, and yes to a career path that they're passionate about. We currently have several programs. One is a community mentoring program with youth who reside specifically in Queen Anne's County, Maryland, with students in grades 7 through 12. We also work with youth that are disconnected ages 16 to 24, and our young people that are struggling with trauma, with mental health concerns, with truancy, with incarceration. And our goal is to be able to strengthen their community relationships and build in rural communities. Our community mentoring program is located at the Kennard Cultural Center in Centerville, Maryland. And this location, as the Kennard Cultural Center, it was one of the African-American schools in Queen Anne's County. And so when you walk in this building, unlike walking into those hearing halls and courtrooms, you see representation in the hallway soon as you enter this building. And for us, that is important and an intentional aspect for our students. So these are two of our mentors in the program, and you can see behind them the picture of Malcolm X. So just being able to see representation when you walk into a space for our students to know they can feel safe, because so many times throughout the day, they are not seeing people who look like them in spaces. We also have, as we talked about this, just say yes to history. We have a history component and program, a history of the shanty towns of Kent Narrows, an area down by people that are familiar with the area of the jetty in Graysonville. And this looks at the people that lived in this area during that time and really telling their story of what was there and on this land before the restaurants and condominiums and condos and all of those things came. But now I get to tell you about the Adolescent Clubhouse, which is one of our largest programs that we have. The Adolescent Clubhouse is a model that is across the state of Maryland. We were fortunate that Mid-Shore Behavioral Health put out a request for proposals to be able to have an Adolescent Clubhouse here on the Eastern Shore. And the Adolescent Clubhouse works with youth 12 to 17. We currently are serving the 5 Mid-Shore counties. That's Dorchester, Caroline, Kent, Queen Anne, and Talbot counties. And it is a prevention program for youth impacted by substance use. Our program is named Club Fear, which fear stands for Face Everything and Rise. Our youth group actually named the program. So we work with our students to be able to come up with that name. So we're split into 2 programs, Club Fear North, which lists the counties there, and Club Fear South. Our Adolescent Clubhouse staff is listed here. We have staff that work in the community, have grown up in the communities that they serve. Our staff are trained in various evidence-based practices, ACEs, BOTM life skills, mindfulness, and strengthening families. The offerings of our programs, trauma-informed care workshops, life skills training that looks like budgeting. We offered a 6-session life skills training a few months ago and had our community partners come and be able to work with our young people. So from social workers to bankers were able to come in. In this site currently, we're building a podcast studio in partnership with Washington College. And so youth will be able to tell their stories and be in the community and interview community members. We also do experiential therapy. So as we talked about this topic with being able to put the medicine in the ice cream, and that's my co-founder, Paul, too, that is his quote, that what we try to do with our program, we don't tell youth you're going to therapy. We ask who wants to go to the horse farm, and our kids are able to pick and choose kind of where they want to go in the workshops that they want to take part in. So we don't say you're going into therapy and this is the reason why. However, there is a social worker on site and they do explain the different elements of youth being able to participate in equine therapy. We also offer support groups. Our LGBTQIA support group is a virtual group that will move into in-person shortly. Youth across the Midshore are able to participate in this virtual LGBTQIA group. And as we want to continue to offer safe spaces for all of our students, we also offer extracurricular activities for students. For February Black History Month, they were able to go to the Blacks and Wax Museum. There was also an empowerment brunch sponsored and held, as you will hear from my colleague, Mr. Miko Jackson, who is one of our partners on the Adolescent Clubhouse Grant. So this lists some of our partners throughout that came on for us to be able to implement the Adolescent Clubhouse. And here are just pictures of our youth and our students on site at the Worthmore Equestrian Center. And again, as we talked about that and what they're able to experience while they are there. We also offer Mindful Mornings with MDA. This is for young men. You're able to call in. Mr. Paul too facilitates this call. He's also doing Mindful Mondays in the middle school. So he goes into the middle school, into one of the behavior classrooms, and he works with those students there. And then he also works with students, about 27 other students at the middle school, and being able to teach them about affirmations, about mindfulness, and being able to get through their school day. And this is showing one of our art activities in partnership with Recovery in Motion. Recovery in Motion is under the Kent County Health Department. They come in and are able to do our substance use information for our students. And then they were able to work through some artwork with an artist, Brickhouse Art. And we know as art is a stress reliever, anxiety reducer, and depression reducer. We also offer virtual reality for our students. They're able to come in, have the virtual reality sets, and they're able to really go anywhere in the world. You can put your cell phone in, download the app, and it connects into the virtual reality set. And this is just a flyer of our life skills courses and what they offered there, from financial literacy to life skills to social-emotional, substance use, Narcan training for parents. We also offered substance use bingo. Again, our LGBTQIA support group that is virtual for our students. And more on history, this is a partnership with Sumner Hall here in Chestertown, Maryland. Youth and students are able to go in. They also offer teacher trunks for teachers to take on site, so they are able to go through lessons of African-American history. One of our main partners, again, Washington College. These students are actually at Washington College in their podcast studio, and they're learning how to build content, to tell their story, to build skill. Because as we know, all youth may not want to go to college, and college may not be the path that they choose. So we try to build skill in all of our programming. And then this is Mr. Paul too. He's in our podcast studio here on site. One of our partnerships last year, we did a hip hop time capsule, and the hip hop time capsule lasts for 4 weeks. It is a paid internship for youth. It is a look at African-American history and music. youth were able to go through the 4 weeks, meet with many musicians and artists, and were able to build their own mixtape at the end. Last year, this was specifically for Kent County youth, and I'm really happy and excited that we're able to have this spread throughout our 5 mid-shore counties now. So the application will come out for the Hip Hop Time Capsule probably about mid-March. Youth have to apply, they have to interview just like a full-time job, and they are paid about $13 an hour to do this internship. So for some of our students, that's a means to buying school clothes, that's a means to helping your family, and also learning skill and building skill into this Hip Hop Time Capsule. We also have a gardening program, which works with youth and seniors in our programs. And so in this garden, everything is growing. This is Vanessa, our urban gardener. She has started building now on our site, garden boxes for our youth. And so with that garden site that we're looking to do, for it to be a healing space, so there will be pathways and edible plants and lighting, just a really nice space for stress reduction and relief. Another partnership is the Sultana Education Foundation. What we seek to do is to be able to have our students experience some of the organizations that they may not have been able to experience other than school field trips. As summer is approaching, we know summer camps are expensive. And so for people of color, Black people, that a lot of times we don't have that access to camp, and mainly because it's 1 week, a $200 camp. And so our partnership with Sultana is intentional, that they have talked about having more diversity into their programs. And so we wanted to be able to do that. And what you see here, youth are, and this is our board and some of our board volunteers and children that are out in going out into the Chester River. And for some, this was the first time out in a canoe. This was my first time in a canoe, and it completely was some anxiety involved with going out in that little teeny vessel and a whole lot of water. And one of our newest partnerships is with the Pickering Creek Audubon Center. And this title is Trailblazing Women and Girls. So we are looking for women, female mentors to be able to partner with another young lady and be able to explore the outdoors. And so anyone that's interested in that, we are taking applications to have you join us. And then finally, coming to a close as well, these are some of our young people on our dock. And here, this picture is for me just a reminder of self-care, just a reminder to take some time. As I stated, I know this information can be heavy to hear as we are going through the day, but this picture really encompasses what the Eastern Shore has to offer. And as long as we are able to combine a lot of our rural partnerships, then we can be creative in the activities and to see outcomes for our youth and families. Thank you. And Katie, I know you all are catching stuff in the chat.
I'm seeing the chat, very busy. Thank you, Don.
Okay.
Amazing.
All right.
Well, so inspired and just really grateful for your contributions and all that you've shared with us this morning. It's a gift, and all that you're bringing to the community. Thank you. I think I think it's Akima who's introducing our next speaker, if I'm keeping up with the agenda. Is Akima with us? Okay. Well, Alicia, would you like to introduce our next speaker if you?
Absolutely. Our next speaker is Amika Jackson. She is the founder and CEO of Harvesting Hope Youth and Family Wellness. She's a licensed clinical professional counselor supervisor, and she's currently a clinical psych student for her doctorate at the Chicago of Professional Psychology. She's certified CNA trauma professional and completing training right now to become a registered play therapist. Ms. Jackson has worked with youth and families in diverse settings for over 30 years. The settings include educational systems, residential treatment facilities, enrichment programs, and crisis systems. She's held positions as a child advocate at the YWCA in Westfield, Massachusetts, before and after care enrichment director in Columbia, Maryland. She is the author of 2 published books, and Meet Mrs. Jones, a foster care book for children, and Mommy, What's a Protest? Her 3rd book, Daddies, What a Racist, will be published in the fall. She has an emotional education game and merchandise brand launching soon. Wow. Ms. Jackson is a board member of the Dorchester Chamber of Commerce, 411 Kitchen Board, and Shore Regional Health Quality, Safety and Experience Committee member. She's received several governor citations, senator and delegate citations, a mayor citation, Living Legend Award from Bethel AME Church, and the Unsung Hero Caliber Award. She is the mother of 2 adult children, 1 bonus daughter, and grandmother to an amazing 8-year-old. Her presentation title today is Criminalizing African-American Mental Health, Race-Based Trauma. It's my pleasure to welcome Ms. Amika Jackson. Thank you.
Thank you for the introduction. Thank you, thank you, thank you. So my name is Amika Jackson, as was stated. And so just hearing some of the stuff kind of got me worked up, and I'm trying to calm myself down. I do a lot of work and research on race-based trauma, and I think it's something that is imperative that we discuss. So I want to put out there that my slide, I am not talking anything about next steps on what we should do, because in my opinion, is not an African-American community's issue. It is a European-American issue. And we've attempted to use our voice in several ways to get the message out that things have to change, only to be met with resistance. And so it's a real conversation that has to take place outside of us almost. We can assist with telling our stories, but as we all know, we're not the ones that's writing the policies and procedures that impacts us. And so that's something that needs to be understood. The other part is looking at the trigger that it does have for European Americans hearing the information, because a lot of times it's that, the belief, well, it's not me, it happened, years ago. Why is race continuing to be a issue and a topic of discussion? And it's because it's real, because as an African-American, no matter where I walk into or where I go, I'm seen as a Black person. So I don't get to hide behind any other ethnic cloth that I may have. I'm seen as a Black person, and I'm going to be treated as such based on whatever norms and morals that the individual was raised with, and whatever the community that they live in see as acceptance or tolerable. And so that's a struggle. I see it every day with the population that I work with, and as largely youth. And I see it in the criminal justice system. I see it in the educational system, and I also see it in the mental health system. And so this is why I chose the criminalization of African-American mental health, because it's criminalized. Things that would be seen normal or normal youth-based behavior is criminalized for African-American youth. African-American youth mental health is criminalized starting in the school system. And so Don Sell and Mr. Jurgen spoke on a lot of my stuff. So some of this, I just will be reiterating what was said, and other information will be possibly new for some of you. So race-based trauma. Race-based trauma is defined as a real or perceived danger, threats, witnessing harm, or humiliating or shaming events to ethno-racial individuals similar to the self that may be sudden, beyond their control, and emotionally overwhelming. Racial trauma can be inflicted by an individual or a system and be overt or covert. It is theorized that racial motivated behaviors towards people of color cause psychological and emotional trauma for some people. Their symptoms are similar or worse than post-traumatic stress disorder. And so systemically, the mental health field has not been kind to African Americans or people of color. The APA recently, probably for the last 2 years, have been apologizing for their role in the continuation of systemic racism. One of those things is race-based trauma not being in the DSM-5. It was something that people have pushed to have added, and it was basically told no, because it would upset European American therapists and mental health providers. African American providers are about 3% of the professional population. And so our voice, again, is dimmed, it doesn't get heard. So when we're attempting to advocate for ourselves, it's not happening. So it doesn't happen in the professional world of psychology, which is a medical field, right? And so if the truth about race-based trauma is not being allowed to be discussed, that's an issue, right? We don't even like necessarily talking about racism in therapy. Our research has shown that when African Americans or other people of color attempt to talk about their experience with racism, therapists kind of dismiss it or tell them that they're overreacting or the person didn't feel that way. And so the person begins to internalize their experiences, or they just stop going to therapy because they don't believe that the people that they're talking to understand or respect their experience. Continued, microaggressions are subtle, conscious or unconscious negative beliefs or behaviors towards a person based on their race or culture. Microassaults are intentional rude words or behavior towards marginalized individuals. These are things that we see consistently, especially with social media, with the terms Karens, when you have the videos of Black people being verbally or physically accosted, being told that they don't belong in a certain space, being cut off in line at a grocery store, and things of that nature. Racial trauma starts as early as conception and can continue across the lifespan. Race and or ethnic-based healthcare disparities start at birth based on racial discrimination by staff, the systems, and how race and ethnicity determine access to care. African American women have the highest mortality rate when it comes to childbirth. And so their symptoms are dismissed. Currently today, still in the medical textbooks, it says that we have a higher tolerance for pain, which is not true. And so when African American women are giving birth to their children, they're not given pain medicine. They're being told that, again, it's not that serious. You're attention seeking, you need to calm down. And many have died on the table because they bled out. I don't know if you all know Judge Hatchett. Her daughter-in-law was one of those people who basically died in front of the family as they were asking for medical help in the hospital. And the husband was told that they would remove him by security because they felt that he was being extra and trying to be forceful. So they saw him as aggressive and not somebody as caring for the need of his wife. Instead, they saw him as a threat, trying to tell them what to do. And his wife inadvertently died because she was hemorrhaging. Historically, systemic racism and race-based trauma started with the transatlantic slave trade. That was between 1525 and 1866. Enslaved people and their descendants have experienced or have been impacted by racial trauma from enslavement, Jim Crow laws, Black laws, segregation, redlining, steering, stop and frisk, 3 strikes law, war on drugs, financial discrimination, employment discrimination, education, children of color being systemically removed from their homes, especially Native American children who have the highest rate of removal from their families, to refusing to teach all of American history in schools. These actions creating poverty, mental and physical health issues. All the systems, social services, medical, educational, justice, hospitals, mental health, banks, etc., has labeled African Americans as a threat and pathologically, essentially dehumanizing African Americans and Blacks. White criminals, including mass shooters, are immediately described as having mental health issues. We hear everything that we can think of about how great they were as a student to what role they played in a play or what sport they played. For Black protesters, right, they're thugs, they're criminals, they're gangsters, they're predators, they're looters. However, white protesters are patriots. And so down to the way that the news describe what we see. We've seen white students get upset because their college lost a game and they're setting stuff on fire, turning cars over, having fights with the cops, and they're being, what the media says is these are children being children, right? But these are 20-some-odd-year-old individuals, 24, some of them 28 maybe, but they're considered children. That's the terminology, and that's children being children because they lost a game or even won a game. When Black folks are out there protesting equality or tired of being murdered or harassed or beat by cops, we're agitators and we're troublemakers, and people pick up on that. When you look at the Kyle Rittenhouses, he's considered a hero. And his mom is too. They're being celebrated, but celebrated for what? When you had the mass shooting at the church in Virginia, you had the police take this young man to go get food because he was hungry. You have unarmed African Americans being gunned down with their hands in the air, running out of fear, not because they've done anything wrong, but then the narrative is they should have just complied. But we've also seen where they have complied and they've lost their lives. And so there are 2 narratives of America, and it needs to be one, and that's the truth of how systemic racism impacts a whole race of people and how other people benefit off of that. When you're looking at the prison system and they're privatized, African Americans aren't the owners of those privatized prisons. European Americans are, or outside people from outside the United States. So we're not making money off of arrest, right, and imprisonment. According to Leopold, Black adults are 3 times more likely to be incarcerated in jail and 5 times more likely to be incarcerated in prison nationwide. While we are more likely to be connected to criminal justice systems, we are less likely to be identified as having a mental health diagnosis or receive treatment while incarcerated. Disparities exist in evaluations, diagnosis, and treatment in and out of the criminal justice system, exacerbating their mental health needs. African Americans have less access to mental health services than European Americans. European Americans are more likely to be placed in a pre-child diversion program than African Americans. Black and African American people with mental health conditions, specifically those involving psychosis, are more likely to be in jail or prison than people of other races. And that basically goes back to being criminalized and dehumanized, seeing as an inadvertently a bad people. That has been a narrative that's been allowed to go across this country from the time that enslaved people were brought here. And it is propaganda. We have to call it what it is. And it's for us, it's changing the narrative and us being able to tell our stories and tell our truth. According to the Children's Defense Fund, Black children were 2.4 times more likely to be arrested than white children. In 2017, Black children were 4 times more likely to be committed or detained than white children. 2/3, 67% of children in the juvenile justice system were children of color. 41% were Black, 21% were Hispanic. And that says a lot, right? And so I'm in the school system, so I get to see a lot of stuff. And I have clients, and so I know a lot of stuff. What I know to be true is that when African-American children are having a difficult time, they're labeled bad. And bad children need to go to jail, right? Or they need to go to detention, or they need to be suspended. But the children who are seen as having a difficult time adjusting, and so I want you to pay attention to my words that I'm saying. So if they're having a difficult time adjusting, or mom may have just lost her job or dad just moved out, and so they need that extra support. So that child is going to get the extra support. The parents aren't going to be called to come pick the child up. The cops aren't going to be called to remove the child either. But for that African-American student who's experiencing the same thing, whose parents are seen as inadvertently bad people who are irresponsible parents, and now I have zero tolerance, compassion, or empathy for what this child is going through, because it's a child, not an adult. So I have zero compassion, zero empathy about what this child is experiencing. And the first thing I want to do is criminalize a child's behavior. And when I say children, I'm talking about pre-K, I'm talking about kindergarten, I'm talking about first grade, second grade. They're having tantrums that is natural for children of that age to do. That's a problem. And that is, again, it's not much that African Americans can keep screaming, yelling, protesting, advocating, because it's not coming from us. We're not the ones that's criminalizing us. It is a whole system that is perpetuated on criminalizing us. Children of color are also disproportionately transferred to adult criminal justice system, where they are tried and prosecuted as adults. In 2018, Black youth represented less than 15% of the total youth population, but 52% of youth prosecuted in adult criminal courts. Black youth are 9 times more likely than white youth to receive an adult prison sentence. American Indian and Alaskan Native youth are almost 2 times more likely, and Hispanic youth are 40% more likely. In 2019, Black female students were 3 times more likely to be referred to law enforcement and 3.6 times more likely to be arrested than their white female peers. So that's using the police to inflict fear on African-American children. And then in the same breath, we tell them that they're supposed to respect authority. But when authority shows up, you're punishing me because 1, the color of my skin, 2, you don't like the way that I'm advocating for myself. I'm supposed to shut up and do as I'm told, as if there's a switch that can come off and on when there's a heightened situation, especially if I'm trying to explain myself to an adult who's refusing to listen to me. And it's that to be seen and not heard. Well, if they don't advocate for themselves and the adults in the situation is not advocating for them, who's supposed to advocate for them? So as much as we say advocacy, 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 when African-American children, teens, and adults advocate for themselves, it can land them in jail, and it can land them in a casket, right, in a grave. And that's the honest truth. We don't have the same accommodations for freedom of speech. Our freedom of speech is seen as defiance and disrespect. And when you're seen as defiant and disrespectful, there's negative consequences that come with that. African Americans receive longer and harsher punishments than their European counterparts. Reports continue to come out regarding false imprisonments of innocent African Americans. And this is something that's always been the case. This is nothing new. We see where judges have colluded with the DAs and the police to imprison innocent African Americans. We've seen on video where cops are putting drugs in people's cars or in their homes, and then they get off. And so their bad behavior is, oh, they're stressed out, they just made a bad choice. But there's nowhere in society where African Americans can have a bad day, a bad moment, or make a bad choice, and that includes our children. The mental health and physical health impact. So post-traumatic stress disorder, on top of the possibility of having race-based trauma, depression, anxiety, addiction, complex trauma, relationship difficulties, unable to trust or connect with people, unable to maintain a job, self-isolating, anger or shame, somatic health issues such as high blood pressure, headaches, and body aches, heart disease as well. And so when we show up with mental health issues to our doctors, it's not necessarily looked at in the way that our mental health symptoms show up is not necessarily going to be the same as the way it does in European Americans. And our symptoms are usually pathologized, or we're attention seeking, or we're med seeking. And that's a problem, right? And so if you don't know what my symptoms are, or you're refusing to accept what my symptoms are, that's a problem. I remember my sister, she has atypical migraines. And so they show up as almost like she's having a stroke, right? And so it looks like she's having a stroke. She can't move. Sometimes it looks like a seizure, and she's gone to the hospital multiple times. And each time we go by ambulance, when we get to the hospital, the narrative is always the same, as if she's drug seeking, to the point where I literally have to cuss people out and get indignant for her to get the quality of care that she needs. She's had that experience multiple times. And I think 2 years ago, one ER doctor paid enough attention to what was going on and was able to explain to her what was happening, and was able to tell her she has asymptomatic migraines. Through all of this, they had tried to make it seem like she was crazy, or that we were crazy, that what we were seeing wasn't what we were seeing, that we were making stuff up. She has her master's degree in marriage and family counseling. She has a bachelor's degree in human services and community development. She works for the Dorchester County Health Department. I have my license, and half of my family is in human services, education, law enforcement. And for us to know how to advocate for ourselves and to continue to be met with medical neglect, because that's what it is, right? It's medical neglect. Because had she left again and not been given a diagnosis, what led to her getting on proper medication to help alleviate that, she could have been driving in her car, had a seizure, killed herself or other people. But that was dismissed and didn't care, because they thought that she was med seeking and thought that we were going along with her seeking medication, when that wasn't the case. I shouldn't have to get indignant. I shouldn't have to cuss at you. I shouldn't have to threat to call the board members of your hospital to have her needs met. No one should have to go through that. But that's what she went through. And I know so many other people have gone through those things. When we have untreated depression and anxiety, it does become a somatic health issue. And so the heart disease, the high blood pressure, the headaches, the body aches, the obesity, right? The substance abuse or any type of addiction, because now I'm self-medicating. And I don't trust that anything that you offer me at this point is something I can accept. We can also look at the way that things played out with COVID when the shots came out. So the market was towards African Americans. Y'all need to get vaccinated. That's what we saw in the commercials. Nobody else was being targeted in those commercials. But what was also being downplayed is the history that African Americans have in systems, right? Hospital care, subpar, neglectful. A lot of Black people don't go to the hospital because what comes out to be true is when they go, they don't come out. And it's not because of their negligence, it's usually because of the negligence of the people who were treating them. And so why would I trust that? When people bring that stuff up is, oh, y'all need to just trust the system. But why keep telling people to trust the system that constantly abuses them and dismiss them? Where's the, again, the empathy and compassion, but where's the accountability for the systems who's created the mistrust? The African-American community didn't create the mistrust. The systems and the European Americans that's in charge of the systems created the mistrust by the abuse of power that they had. Healing. So there are very few treatment modalities that target African Americans and other people of color. The ones that are out there is HEART, which is Health, Ethno, and Racial Trauma, RECAST, Racial Encounter, Coping Appraisal, and Socialization Theory, Historical Trauma, and Unresolved Grief Intervention. All of these are really based on Hispanic, Native American, and African culture and how they heal. We're bringing the community together, and you're not doing it alone. And so part of it is advocacy. The other part is being able to tell your story and to be heard. And then also it includes meditation, yoga, sound healing, and all those other amazing alternative ways of healing. And so it actually takes people back to their cultural healing traditions, which I think is important. Micro interventions that address microaggressions, such as allies standing up and addressing things immediately, educate the perpetrators, and to seek support from individuals trained to heal racial-based trauma. Again, a lot of the work that I inadvertently do or the therapist and people that work for me, this is what we do, honestly. We do a lot of healing work, we do a lot of advocacy, and it's exhausting. It is exhausting work to have to advocate for a community, be it a local community or a global community, and expect to show up, a certain way. And then if I show up that way, you're not hearing us. And so I get a little loud, or I'm a little passionate about the way I talk. Now I'm aggressive, or I'm presenting as an angry Black woman, or if it's a Black man, he's presenting as an angry Black man. And nobody's ever taken into consideration, are you hearing what's being said, right? Are you seeing, are you allowing yourself to see what's happening? Or are you dismissing it? Are you making excuses for it? If you're in the room and you see stuff, you need to say something. Because here's the thing, just as uncomfortable it is for you to say something, it's uncomfortable for us to have to constantly live through it. It is an everyday battle for us that we have to live through. No matter where we show up, how we show up, it's an issue. And it's an everybody's issue. Because here's the thing, if you're incarcerating an African-American with mental health issues, you're wasting money, right? It costs about, if we're looking at insurance, it costs about $5,000 to $6,500 a year to provide therapy for an individual weekly, right? It costs about $588 a day to house a child, and it's triple that to house an adult a day for mental health, for imprisonment. So it's about $288,000 a year to incarcerate somebody, as opposed to the most, through insurance, public dollars, $6,500. It doesn't make sense to perpetuate mental health issues instead of advocating for quality of care, immediate care, as opposed to exacerbating issues. And so for me, it's us saying where we want our tax dollars to go. Our tax dollars should go into healing a community. And it's not just healing the Black community, it's healing the white community, the Asian American community, the Hispanic community, the Native community. It saves money. And at this point in time, it's 2022, we shouldn't be still having the same conversation of something that should have been handled 50 some odd years ago. And that's it. That's all I have to say. And so thank you for the opportunity to speak, and I look forward to our breakout sessions. Thank you.
Thank you so much, Amika. It's a pleasure to introduce Intercept 2's presenter, Ms. Amanda Tondon. She began her career in criminal justice as a criminal clerk in York, Pennsylvania, but she decided to return home to Easton, Maryland, to assist her community through the penal system. She received a Bachelor of Science in Criminal Justice with a double minor in Criminalistics and Intelligence Analysis. Currently, she is attending the University of Maryland Global Campus to obtain a Master of Science in Criminal Justice Management. Amanda joined the Talbot County Department of Corrections in February 2019 as a correctional officer. In January of 2021, she accepted the position of inmate case manager and is responsible for assisting with operations and administration of inmate programs, handling all internal needs of the inmate population, and oversees all participants in the pretrial supervision program. Let's give a warm welcome to Amanda Tondon, whose presentation title is The 5-Year Reflection of Detention. Thank you.
Good morning. Thanks again for having me here to speak. In Intercept 2, I'll be discussing the initial detention, how the process works, and what the detention centers are seeing in regards to race. I've been with the detention center for about 3 years, and how I chose to try to identify trends and patterns is to compare the inmate population that we had in 2016 to what we had in 2021. The trends and patterns that I'm seeing in our detention center, I believe, closely reflect what other detention centers are most likely witnessing also. Before I jump in, I would like to share a few facts that I did find during my research that I thought was interesting. On average in the United States incarcerates 716 out of every 100,000 person. 50% of incarcerated individuals return back to prison within 3 years of their release. 1 in 9 Black children have at least one incarcerated parent. Black Americans are half as likely to receive any mental health care. Asian Americans are approximately 1/3 likely to use mental health services. People of color are most likely to be uninsured and to have the lack of sources to continue care. Black Americans and Latinos have lower access to treatment, often terminate treatments prematurely, and experience less responsive care. So a few things that I'm going to discuss, and hopefully you guys can get out of this, is to understand the intake process that we do in the jail and how classification affects how we house our inmates. Different services that the detention center provides to the inmate population while they're in here and when they are released, to see some trends that we are seeing, and hopefully give some type of solutions to how to handle racial disparity in a correctional setting. So initial detention begins with the booking process. When a person gets arrested, their initial intake is completed with the booking officer, where they collect their personal information, fingerprints, and is logged into our system. At this time, the booking officer asks the arrestee a series of questions regarding their mental health, physical health, substance abuse history. After that, they are seen by the district court commissioner, who then determines if some type of bond is appropriate. If the person is held without bond, then they will see the district court judge the next business day. If they are committed to the jail, that is when we complete a pretrial assessment. And that is usually done by the case manager or the classification officer. And this assessment is useful to make aware the judges, state's attorney, and the public defender or their private counsel aware of any financial, housing, and health issues the individual is in or in need of, to better assess how to help them. We also include a risk and needs assessment that identifies the possibility of the person that will show up to court and if they are a risk to the community by a point system. The point system consists of the severity of charges, their criminal background, current employment, housing, education status, which helps us determine how they would do if they were released. We then make a recommendation on what we believe is the best case scenario for the community and for the individual. So most of the time we will recommend a substance abuse evaluation or mental health evaluation, treatment, educational services, or job searches. If the judge allows them to be on a pretrial supervision program, the best way I can describe it is probation before sentencing. It would be my job or the case manager's job to stay in constant communication with the individual while they're out on bail and make sure that they're complying with all other conditions of release that the judge has ordered. That includes no contact orders, stay away orders, complete treatment, and maintain employment. If the person is held, we then do a very similar process, which we classify the individual. So the screening tool that we use, very similar, but we also base it off of our interaction with them, which is either nonverbal or verbal behavior. Usually people aren't very happy to be incarcerated. So usually you can tell a lot about their body language of how they feel about situation and if they're going to be aggressive, violent, or you can try to identify some mental health issues. So the risk needs screening identifies substance abuse, economic status, suicide risk, mental health, and any military services. The custody evaluation looks mainly just at their criminal history based off of their current charge, serious criminal history, escape history, disciplinary history while incarcerated, felonies, any drug abuse history, and any stabilizing factors that they might have, which could be if they lived in their house for over a year, have maintained employment, and over a certain age, they are most likely to be stable. And the last thing that we look at is the programs recommendation, where we would identify some programs that we have in the jail that would help them while they're here to kind of help them be more successful once they are released. Some factors that we look at for housing. Classification of inmates is a critical role that is for selecting housing for inmates. We primarily use classification is to help keep order in the correctional setting by dividing inmates into different housing units based on their security threat level, which could be a minimum, medium, or max. So one of the factors that we look at is we try to prioritize their needs. One of them is if they have any medical issues or mental health issues, we look at their severity of any diagnosis that they have, determine if they have an understanding of the circumstances that they're in, and any disabilities that will be needed, if they need any type of assistance. Another factor is we look at their attitude and behavior, like I said earlier, based off of verbal and nonverbal interactions, based off of their body language and their engagement with staff. We look at their substance abuse, depending if they're detoxing or withdrawing on any type of substances. They'll remain under constant supervision until the medical department can safely say that they can be moved to a general population pod. Another thing that we have to consider is the severity of the crime. Some inmates have very serious charges that can have them be at a higher risk of victimization while incarcerated. So oftentimes they don't feel comfortable enough being placed in general population, and that is something that we really need to take seriously and take into consideration when placing someone. The last thing that we look at is race and age. We need the pods to reflect the community that we live in. So we do not separate, or pods should not be separated based off of how someone looks or their age. Speaking off of for Talbot County, we're very fortunate to have so many great sources that are helping us while inside the facility and on the outside. The inmates are chosen for programs and assistance based off of their risk and needs assessment, which occurs during their intake process, or if they request to participate in certain items. So one agency that we work with is Chesapeake College. They've been doing a GED program for us, and we're currently working with them to have a workplace excellence program in here, which provides training and skills that can be used to enhance their ability to obtain employment and receive promotions once they get released. Another program that we're working with them is a construction training, which can provide them with an OSHA certification, which can provide them with a construction job, which might be a little bit easier for them to obtain with a criminal history. The Department of Social Service, they conduct our parenting classes for both our fathers and mothers to assist in understanding communication and growth within a family setting. They also help us with collecting food stamps, medical assistance, and connecting any individuals in here that have child support cases. We work with Midshore Mediation. They conducted a conflict management class for both our male and females, which taught them about communication, coping skills, and how to handle their anger in a better manner. They also assisted in mediation between inmates and their family members to help rebuild any type of relationship before they are released. For substance abuse and mental health treatment, for everyone that is on pretrial, most likely they are required to have some type of an assessment. So we send them to Shore Behavioral Health, Life Energy Wellness, Eastern Shore Psychological. Usually we try to complete the referrals and set up appointments while they're in here. So it's just one easy step that they don't have to worry about. It's a smooth transition. We also use transitional housing, which also helps them build a better positive environment. Make sure they're keeping them on the same path that they need to be on without any other distractions in their, I guess, normal environment. We also have inpatient treatment. 3 that we use around here is Hudson Behavioral Health, Avenues Recovery, and the Whitsitt Center. We use the health department to provide medical insurance for addictions, mental health, and birth certificates. Midshore Behavioral Health has been helping us with addiction, crisis service, and completing RRPs for housing for individuals. And the last thing is government documents. I think that every single person that comes in here does not, a lot of them do not even have their birth certificate or social security card, and sometimes not even a valid driver's license or even a valid ID. So we've been working with the NBA and Department of Social Security and the health department to try to obtain these documents before they leave. So the graph on the left shows the current population by race for Talbot County. As you can see, that majority is white with 83%, and with the second being African Americans with 13%. The graph on the right displays the current population by race that we have in the detention center from February 18th was the last time I pulled the data. So as you can see that in our population, from that day, we had about 85 inmates in here with a max bed count of 125. Majority of our population is being made up of African Americans with 59%. Following that is white with 31% and Hispanics with 10%. So the current prison populations that we have from Talbot County residents, we have about 100 Talbot County citizens, 5 female, 95 males that are incarcerated in Maryland state prisons. 63% of those inmates are of color. 313 Talbot citizens are on parole and probation. 64% is white, 34% is Black, and 2% is another ethnicity or race. And on a national and federal level, 71% of males and 53% of females are of color that are incarcerated. The approach that I took to determine change is to collect information from our jail system from the year of 2016 and the year of 2021. This kind of gives us a 5-year difference to look at, see if there's any large changes in who is being arrested. So the graph on the left shows a year 2016. We can see that there's 3 major race groups that reflects our community, which is white, African American, and Hispanic. In 2021, there was a large change in race that has been arrested. The difference of 5 years is an increase in the African American and Hispanic community. The African American community went up 5%, as did the Hispanic community. And there was a decrease of a difference of 14% in the white population. We are seeing a little spike with the Asian and biracial community. From these percentages, we can now ask a question of what kind of change is triggering these influxes. Another factor that I thought would be interesting to look at would be the recidivism rate and see the types of crime that individuals are being rearrested for. So recidivism is defined as the tendency of a convicted criminal to reoffend. The table displays a number of individuals that were rearrested for another crime after being released from custody. It also goes a step further to break down if it was a felony or a misdemeanor charge. So we can see from 2016 to 2021 that the rate did drop 9%. We can see that there was a decrease in felonies for the African American and white community and Hispanic community for misdemeanors, which is, off of this information, it's great to see that we are heading in somewhat of the right direction with decreasing these numbers. But now we're seeing a little slight increase of misdemeanor charges. For example, of a few misdemeanor charges that could be reflecting this is traffic charges, assault second degree, violation of probation, failure to appear, CDS possessions, and theft charges could be considered for the misdemeanors. In my research, I found at least 3 common areas that I feel that plays a role in race, which is family, age, and education. Currently, we're seeing a cycle of individuals from the same family committing crimes. So now we're receiving sons, daughters, cousins, siblings of past offenders. The study that is written below found that individuals that have more educated fathers are are associated with the rate of arrest and convicted by 26 years old. Rising rates of arrests and convictions are associated with lower probability of being married, fewer weeks worked, lower hourly wages, and lower family income. On age, on average, a Black man by age 26 makes up 33% of the incarcerated population, where the white population is 23%. 62% of Black men are most likely to be arrested multiple times by the age 26. In Talbot County, we're seeing an increase of teens getting arrested and the older population. Teens are most likely coming in with drug-related offenses or assaults and with some type of mental health issue, while the older population between 50 and 69-year-old are getting arrested with drug-related offenses. For education, less schooling is correlated with higher arrest rates by the age 26. And that is being seen in all racial groups. 60% with less than a high school degree have been arrested at least once by the age of 26. The overall higher rate of arrest by 26 among Black adults is between the age group of 26 and 35 that are correlated with a lower education level. The combination of all these factors could be an indirect response to individuals in poverty or who are in need of government services or assistance. A new factor that I think is coming into the picture that some of the other speakers have already spoke about, COVID-19 really showed the lack of diagnosis and mental health services within reach for individuals that are in need of it. Inside the jail, we are seeing individuals come in with bipolar, manic disorders, and schizophrenia who have been unmedicated for a while. On the right, I thought it was interesting to see the top 5 charges that people were getting arrested for 2016 and 2021. As you can see, it's kind of the same five charges that are being cycled. So that is just telling us that the same issues are continuing to affect this, at least this county, and that whatever we have in place is not really helping the situation. A few recommendations I think that could help is having a developed reentry program. It's a great tool to use to reduce the recidivism rate, improve public safety, and to create opportunities for individuals that get released. One thing that we do is create a transitional plan, which basically helps us identify the needs and programs that an inmate is already involved in when they got incarcerated. And it gives us adequate time to find services before they are released. So once they get released, that it is a clean transition, so they don't have to worry about where's my next meeting, how am I going to get there, I don't have anywhere to live. If they don't have to worry about those factors, then that takes weight off of their shoulder. Another thing is to have better connection with local agencies prior to be released. We are fortunate to have many agencies come in here, and developing a stronger relationship between the detention centers and local agencies will also assist in a smooth transition from incarceration to becoming a functioning member of the community. Also, peer support. We have peer support through our health department, and I think it's one of the greatest tools that we have. They're very knowledgeable and helpful in assisting individuals that are already released and helps them stay on their course. So we use peer support a lot with our pretrial supervision participants. They can help them, they interact with them on a daily basis. They help them find treatment, provide them rides to even AA meetings, NA meetings, to job interviews, or even to their work. So they really give another helping hand. Another thing that I think we all really need to focus on is breaking the stigma. stigma of seeing individuals that don't look like you or us, and automatically thinking that they are trying to commit a crime or they don't belong in a certain area that they're in. And I do believe that law enforcement and the judges should also be brought in on this conversation to kind of see their perspective, because really we are the middleman right now. So we don't tell people to get arrested. So I think that we should really hear from law enforcement on decisions that they are making, and then to the judges on why people are being held and not being held. That's all I have. Thank you for your time.
Thank you, Amanda. Thank you so much. Oh my God, what an awesome presentation. I love that data information that you shared. And my apologies to everybody for earlier with my audio not working properly, but you know what? It gave me a minute to recoup and get myself together here. So thank you so much. This conference is really doing something to me today, y'all. We are really in here and really getting the information that we need to progress as a community. So at this time, we are now in Intercept 3. And I am going to be introducing Wardens Herbert Dennis and Wardens Charles Scott. And I'll start with Warden Dennis first. Warden Herbert Dennis has been working in the correctional field for 34 years. He started his career at Caroline County Detention Center, and then he left from there and went to work for the state of Delaware prison system. After 2 years in Delaware, he returned to Caroline County Detention Center, where he worked his way up through the ranks from the position of captain under Warden Ruth Colburn. In 2014, he retired from Caroline County, and 2 days later, on August 4th of 2014, he started as warden in Kent County. All right now, Herbert Dennis. Throughout his years in corrections, he's had many responsibilities as a correctional officer, community services, internal affairs, deputy warden to warden, and he said he will always consider himself a correctional officer because he never forgets where he started. And he said, as a warden, I have been fortunate enough to have worked with some brilliant leaders, and that he will always take guidance from them and make the right changes to be successful with his career in society. Now on to Warden Charles Scott, and they're going to present together. Warden Charles Scott came to Caroline County Detention Center after serving 6 years in the United States Army as a military police, 29 years with Prince George's County Department of Corrections, and 19 months with the District of Columbia Department of Corrections. And he's currently approaching his 3rd year as warden in Caroline County. He says that while serving in the military and employed with various agencies, he's held several positions and received multiple letters, awards, and accommodations that include a Gold Medal of Valor for saving a life. He started in corrections as a housing unit officer, which was his passion. And from there, he went on to processing, transportation, medical unit, mental health, zone commander, emergency response team leader, operations inspector, assistant shift commander, executive assistant to the chief of security, tactical operations commander, assistant commander of special operations, and the commander of special operations in Prince George's County. Woo! Hold up, I can't even say all this. Okay, sir. After completing his career with Prince George's County, he was recruited by the District of Columbia Department of Corrections, where he held the position of major in charge of Shift 2 as the correctional treatment facility, the Armory, K9, and ERT for the correctional treatment facility, and the Central Detention Center. After working with the district, for 19 months, he was made aware that Caroline County was looking for a warden. And I've been with Caroline County since May of 2019. He was born and raised in Kent and Queen Anne's County, so he's familiar with the Midshore. All right, gentlemen, it's your time. The floor is yours.
Right. I think you forgot somebody. I think Warden Cook was actually supposed to be a part of this presentation.
Oh, I'm so sorry. My apologies. Did he want to get in with the two of you?
I thought he was, but I mean, there's a lot to talk about, so. It's totally up to
Okay,
them.
well, whoever would like to go ahead and present, the floor is
Okay.
yours.
Okay,
Okay,
I can start first. It's fine.
thank you, sir.
All right, thank you. I'd like to thank Midshore and for actually having us on this conference. It's been amazing to actually listen to all the presentations. Very powerful. I kind of woke up this morning to some trauma and looking at the television when I seen Breonna Taylor, what happened with that, how the police officer actually got off from killing the young lady as it was a murder. And then you have to understand that we live this every day as a black man, as a black woman. We live this every day with this trauma, right? And we see this, and then we have to go to work and deal with this on a daily basis. Being in this great state of Maryland is kind of funny because 70% of our prison system is locked up with African Americans. And it's hard to deal with because we want these things to change, because these are people coming from probably our communities who are living in these hard times when they're being judged for no reason. Or they don't have the resources to help themselves. And being in a warden position, we got to figure out how can we change this narrative, which is kind of hard. And because we can be biased on one end, but we got to make sure we're doing the reality thing on the other end, right? So we implement programs, as Amanda was telling you. She's pretty much on spot with all of the detention centers. We all do pretty much the same thing because we're governed by law. But we have to think out the box, because a lot of the people that we're getting inside these facilities, they don't have a great education. A lot of the men can't be connected to their family because they've been in and out the system a few times. So they find themselves homeless, trying to find somewhere to live, can't get a job because they have a criminal background, and it's just unfair, right? I have a friend who was an addict. He's doing 125 years in prison. He wasn't a bad person. He just had a drug problem, and he was a 3-time loser, right? So he go in front of the judge with the laws of the 3-time loser. They give him 125 years. He went to jail. I imagine he was in his 30s. He'll never recover from that. He'll never recover from that. He'll be in there, and we'll probably never see this guy again, which is a shame, because he left 4 kids and a wife that's out. And it's unacceptable. It's unacceptable on what goes on in corrections. Dealt with another young man since I've been in the warden's position who ended up getting 20 years in prison. And a Caucasian guy who does the same thing, he gets 18 months house arrest. We don't understand how that comes about, but we all come down to the same thing. It's about race, which we know that it's not fair, and crime isn't fair. You know what I mean? If you break the law, you're gonna get in trouble. But we gotta fix the system some kind of way to make people understand that you're destroying lives, you're destroying families, you're asking schools to change, but kids don't even understand because they're separate. They're walking into school, families unseparated, they're hungry, you're not feeding them, teachers judging them because they act out. All of this stuff, it don't make sense. we're in a position to change it. We have great leaders, and I feel like we do this a lot. For me, I feel like we do this a lot. We sit in front of each other, we start talking, but when this is over, are you going to go home and actually make a difference? Because I say I get to make the difference. Ward and Scott get to make the difference because of the job that we have. But are you really going to go home and really try to help make a difference? Are you going to go talk to your mayors or your counselors or your judges and say, listen, this isn't fair. You got to change some of these things. You know, we can't keep doing this. Because we're getting nowhere. We're getting nowhere. We actually, Kent County is a small population. It might be 13% African American, but I can surely tell you that there's more African Americans inside my detention center than there are Caucasian or any other race. And it's for small charges. It's minor things. You know, and we have to find a way to change some of these things. A lot of times, everybody can't go to college, right? And we actually put that on society that everybody needs to go to college. Nah, it's a lot of times you just need a trade. You need a trade. You need to. We did flagging. We done had people graduate while they're in the detention center from school. I'm taking the CDL class now so I can implement it into the jail so we can change some of these things for these guys that's coming to jail. People just want a chance. But if you keep judging by the way we look, it's hard. It's really hard. And I can tell you, I've been through all this. I walk into meetings and they judge me before I even open my mouth, right? You know, and it's crazy. So sometimes I just sit back and listen, because some of the things that may affect your race, that isn't how it works for me. That's not how it works. So I have to go back and implement things in the staff that is going to work for everybody. Black, white, brown, it doesn't even matter. You know, but at the end of the day, it has to be something, we have to draw some kind of line that is helpful for everybody. There's no judgment, there's no entitlement. We know there is, but the only way to fix it is everybody get judged on who they are, not for what they look like. And it's disturbing. I'm not an African American man. I'm a black man who lives in America. Ain't nothing African about me. I've never been there. I can't even tell you if I want to go. I care, but there's things that have to change, y'all. All the presentations were on point. It takes away from a lot of things that we do. We all know, I just told you 70% of the detention centers are locked up with African American men. 50 to 60% of them for nonviolent crimes. Just unheard of. It's scary. You know what I mean? I get pulled over by the police. I get scared. I'm not gonna lie. I get scared. I get scared that if I get pulled over and that I might not make it home to my family. He could have a bad day. I've been judged until I show them my ID, and then when they see my ID, they say, oh, okay, sir. Man, what difference? Why don't you treat everybody with respect? The way we're gonna fix this is we're not judging people. We're going to give everybody the same opportunities. Got to put vocational things back into schools. Everybody don't have to go to college. Have to do these things so people can survive. It's the only way we're going to make it. It's the only way. And if you think anything different, you're wrong. Everybody don't have to have the bachelor's degree to be successful. I mentor young men who came out of prison, who do make a lot of money, who do have their own businesses. It just takes giving a chance, not judging. Will you invite me to your table and let me eat without judging me? A lot of you say, yeah, on this camera, but when it's time for me to open the door, a lot of you won't open the door and let me sit down. So, Warden Scott, I'm pretty sure you have a lot to say. Please, you can join in. Thank y'all for having me.
Well, fortunately, in listening to Mr. Jernigan and Ms. Wilson, Ms. Jackson, you know, a lot of the things I had to say were said, you know, and I'm happy to hear that, you know, running a facility like Warden Dennis said, there's a lot we do. We do what we can do. But I also agree that the police and the court play a larger part in the areas that where the disparity lies versus inside the correctional facility. You know, we have our programs, we try to deal with any special needs an individual has, from medical to mental health to addiction. A lot of times mental issues lead to addiction and vice versa. Addiction leads to mental health issues. And as a lot of us know who work in the system, probably about 15 years ago, and they started shutting down a lot of the mental health facilities and cutting aid, then the correctional facilities became the mental health facilities. So we have to deal with these people. And we have something we call crisis intervention training. And through crisis intervention training, we sent our people out and try to put them in a position to better identify these individuals that come in that may be in a crisis or may live in a crisis 24/7. So in the facilities, I think we do what we do, but also being a young man of color on the Eastern Shore coming up and then moving across the bridge to the Western Shore and doing my time in the military and being all over the country, is so many things I've seen and dealt with, you know, that I understand how easy it is to get locked up. I understand how fortunate I am to be on this side of the bars. And I've always carried it that way since I've been in corrections, since day one. You know, when I came up, I think I've been angry personally since I saw Roots in like 1977. And it's something that comes, it doesn't go away. You have to learn to deal with it. You have to learn to get to know yourself. You have to be a master of you if you are a man of color. And you have to teach your kids and the young people how to respond when they're out there and they're dealing with certain situations. Me, I've been doing what I've been doing since, good God, 1982 is when I joined the Army in January. I was a military police. Then ever since I've been in corrections. But I've been stopped 6 times and had a gun put to my head, just driving. And like Herb said, then when they find out who you are, they want to give you apologies. One time my daughter was in the car. It wouldn't take much. It takes a whole lot to sit there and shake your head and bite your tongue or tell them, call your supervisor, because I'm not moving anymore. But every time I see an incident on the news where an unarmed individual gets shot and nothing's done about it, I know that could be me. We, as communities and people of color, I'm glad that they have an organization like Maneri's Dream Alliance in Kent County. My sister had said something to me about it, and we need more of it. We need more mentors. We need people to get out there and communicate, because although for all these years, you know, they say they throw a little scraps here and there, and you look at everything we've been through, you know, limited knowledge of your lineage. You don't know where you came from, half of us. When you try to do your research, you find out you only go back to about 1864, 1866, because prior to that time, guess what? We weren't even really considered to be human beings, you know, and then you learn from your family, your ancestors, your grandparents, your great grandparents. But in a lot of cases, it was limited where they could go, it was limited what they could do, what kind of jobs they could get, you know. So as changes come about, I guess we need to communicate. The information needs to get out. We need to get past the stigmas and the fears. We need to address the issues that individuals have and consider the reason that they have these issues, because it's not something that just wasn't automatic. This was created over the years. I mean, no matter what, if we don't address the history, so much of the history is swept under the rug and nobody wants to talk about it. But at the same time, when you learn about your history, you're going to be angry. So we're going to need anger management. You're going to have to be able to deal with it. So how do we address all that? We only have a handful of people and a handful of organizations that's out here trying to do something, that's trying to make a change, you know. But the way with everything we have to deal with in our position, is certain things we got to be careful what we say and how we say it. I mean, I can't go through the correctional facility and tell individuals what to do and how to do it outside of my policies. You know, it's my job to be firm, fair, and consistent, and I do that. But I'm also understanding. I don't treat a person different because of the charge they come in the door with. And then in a system like this, just like was mentioned several times, you see individuals who get a charge that gets 20 years, and another individual that does something 10 times as heinous, and they get 5 years or 3 years or no time at all. It's very difficult to navigate this system, even being in uniform. So I can't imagine what it's like if you come up on the street, you don't have a father, you don't have any type of guidance. If you look back, you will see that every community that had a high population of people of color in the cities was flooded with heroin. And we still see the effect of that today, Baltimore included. I've lived in Baltimore. You know, I've talked to the older people and seen where they came from and how hard they worked to get where they got. But once things started getting beautiful, Baltimore was a very beautiful city. The drugs tore it apart. Then comes the crime. Now it's getting out of hand. So it's a lot of work to be done. I'm willing to do my part. I hope everybody else is. I hope we can get this information out to the communities, get it out. I don't know what we'll do about the court system, because we have no say over that. But in time, if we work together, I feel we can accomplish more. That's for sure. I don't know if Warden Cook wants to chime in and say something, so I want to give him a little time if he wants it.
You two guys are a tough act to follow. I'm so glad that I was able to be on this event today. I've been in this business 46 years, believe it or not. Did not plan it this way, but it's just what happens. I've had a unique experience of being in both police as well as corrections. I also am unique in the sense that I wasn't born and raised here. My familiarity with the Eastern Shore was coming down here every summer from the city. Most of my upbringing was in an urban environment in Baltimore, Philadelphia, and New York. So coming here in the summer was a lot different than moving here and living here, because I got an awakening about a lot of things. I'm going to mention a few names because it's very important that outside of your family, and your family is your support, I was always asked, why did you stay here? Knowing what some of the things that Mr. Scott and Mr. Dennis spoke about. They'll know a couple of these names, if not all. And some of you that are listening today may know some of these other names. Ira Buck Shockley, Ernest Leatherbury, George Rudolph Brown, Bartis Vickers, Alan Blizzard, Bob Salit, Edgar Johnson, Reverend Clarence Hawkins, Virginia Larimore, Doug DeLever, William Foster, Harold Reese, and Bill Pickman. When I came here back in the day, these were people who worked to convince me to stay and make my career here. I will tell you something, because when you are, what I said, the first, you have a unique experience. I was the first in my area, I think even in the two counties here, Queen Anne's and Kent, to be in a major law enforcement role, starting as a deputy sheriff and working my way up to chief deputy in Kent County, and then becoming the first ever appointed warden here in Queen Anne's County. As I listened to Don Sella, I do know what it's like to be an elected official. I've also served in that capacity. I also have been very fortunate to get into government. But I will tell you my first experiences here, and I know we don't have a lot of time, I'm trying to be very brief as I can, because these two young men who I know very well, and I watched Scott grow up, and I've known Herb for a number of years. And I don't want to neglect to note that Kenny Rogers is also on here, and he's over in Dorchester. We have not had as much contact with each other, but we've been very familiar with each other over these years. My first experiences here were pretty much like, and some of you people will know what I'm talking about, in the heat of the night and walking tall. I got my eyes open when I first came here. If you're not familiar with those movies, now grant you, movies can be a little more melodramatic and add a lot of stuff to it, but there's some elements in both of those movies that I relate to because I experienced those things. One of the things as a person who's been around as long as I have, and somebody called me the OG and then some other nicknames, I've learned to survive. And I see somebody picked up something and started laughing on one of the screens here because they know how I am. We go back a ways also. Take to heart what these young men have told you. They were born and raised here. Me being in an urban environment and my family is multi-ethnic, I'm not going to sit here and tell you that I didn't experience a number of things too, even before I got here, but not into the way that these young men have, because they grew up in that. One of the things I want to tell you, and I'll get into something else, and I said about managing diversity, because I have to do that here with my agency. I'm going to say a word because Scott brought that up about a term. I'm going to give this term, it's a very simple term. And depending on which one of you, what your backgrounds are, who are listening to this presentation, I'm going to say this word. And this has to do strictly with culture, because I've done this in every class that I teach, both in police and corrections. The term is roots. Now, I've said that term, and I'm not referring to a plant, and I'm not referring to the TV show Roots with LeVar Burton. I think a number of people that are listening to this will know what I'm talking about, and a number don't. I do this with every class, and I'm surprised at the response that I get, because I see members of one group that relate to it and others that don't. That is strictly cultural, and that's part of the African-American and minorities, even I found that in Latino cultures, that has a different meaning. Which, when I talk about supervision and you're supervising an agency and we talk about diversity, you have to be well-versed in the staff that you're working with and the offenders that you're dealing with. You have to understand those cultures. In doing so, you avoid a lot of problems. And you can minimize problems if you're familiar with that. It's hard when you're trying to talk to people and they come to you, your staff come with problems, and you have to know what to say and what not to say, because you have a very diverse staff. You have females, you have males, you have African-American, you have people of different cultures that you're working with. And when you address things, even in a disciplinary manner, you have to be mindful how you present these facts and all to them. Because sometimes you can say something, and yes, I've had to deal with issues amongst staff that have to do with ethnicity or culture. And I'm going to mention one situation that I had here when I first became the warden. And it had to do with icing on a cake. Icing on a cake. And we used to have something that the staff had started back then, they don't do it now, was when somebody's birthday came up, somebody would make a cake for one of the officers, and they have a little small celebration in the back. And in this one case, I got called in the back, and I had to be very brief how I say this, that, Warden, you better come back here. And I went back, and I said, what's the problem? And they pointed at the cake. And I'm looking at the cake, and I said, okay, it's a cake. What's the big deal with the cake? Look at the cake, they kept saying. I'm looking at the cake. So I said, will somebody tell me what the deal is with the cake? The cake had black icing on it. I still didn't follow it right there. And then it dawned on me. The person who made the cake happened to be Caucasian, and the cake was made for an African American. That got to be the issue in that particular case. And that was my first real taste of trying to manage diversity in my agency. Wasn't very easy to take care of. It took me about a week to get that resolved because of the impact it had on the staff at the time. So it's not easy all the time when you're dealing with diversity when you manage folks. It's not always easy when you're dealing with people who call on the telephone and they're raising the devil on the phone because of the way an offender presented a situation, which may not even be the way it was presented. And you try to deal with that. And I try to talk to people that come to me, whether they're African-American, whatever, about issues that they may have. And, you know, you try your best because you use your experience to address what their concerns are. It's not very easy. And when I know somebody was asking me for my bio for this, I've had a lot of experience in different flavors. I didn't want to put all of them down because it would probably take too long to note what they were. But I've been very fortunate to have people, not just my family, but the people that I noted on that list of names back in the day, and even more in these times, who kind of helped me steer through a lot of these challenges. I want to tell you to think of something else, and I'm talking about my brothers and sisters on the police side. I do agree that we need to have discussions with the police as well as corrections. And I know we talk about Memory's Dream, and I really have watched that from afar. And Herb and Scott and I would probably like to be involved in some sort of way, but sometimes our schedules are such that it's kind of difficult to work in the community in the way that we would want to. But I've been in the position, and we talk about decisions that have to be made. And many times, and I'm not just going to say this about police officers, but I have to say this about corrections people. And yes, we are never probably viewed by the public in the way that the police and other public safety agencies are viewed. But just imagine whether you're in a patrol unit or whether you're on the floor of a correctional facility and you see a disturbance or some issue when you pull up into that situation, and you have to make a split-second decision as to what action you have to take when you go into that dorm or that pod, or if you have to pull that vehicle over and run on a street to address a crisis. What decision do you make in that 2 or 3 seconds that you have to make that decision? And it's unfortunate that many times when we make those decisions, we run into the very issues that Herb and Charles and others have talked about. And everything that I've heard this morning from Mr. Jernigan, Ms. Wilson, Ms. Jackson, and the facts that the young lady brought from Talbot County, all are very valid. Don't doubt what you're hearing today. Those of you who may not have lived the experiences that some of us have, you know, I'm here all these years in Queen Anne's, why I've had the opportunities that I've had, including 1 year running Queen Anne's County a few years ago. I never dreamed of that. I never dreamed of even being in police work, because a kid growing up in West Philly, that's not one of, at least where I grew up, around 55th and Pine, that wasn't a dream that I had growing up. But those opportunities have come. And people saw something in me, I guess, that they allowed them to take a chance, especially with George Rudolph Brown, who happened to be a relative, but he was the first African-American to wear a police uniform in Kent County. I was the first African-American deputy. Buck Shockley, and I can only mention these 2 names right now, and I don't mean to pass over all the others. Our Buck Shockley out of Worcester County was the first African-American appointed as a warden in the state of Maryland, as far as I know, on the record book. And through them and all these other names, Vardis Vickers, who hired me, who took a chance and hired me to do what I've done. I had no idea that I would be here this long. I didn't plan it. But I want to tell you all, take very seriously what you've heard here this morning. And I've worked with many of you that I see on the screen, and a number of you that I don't see. And some of the people I see on the screen, I have not really involved myself as far as meeting with personally. But take for heart what you've seen this morning. I don't want to go over my time, and I know I probably have done that. But it's been a pleasure to be part of this. I know we have a question and answer period coming up later. So thank you very much for the opportunity.
Thank you all so much. I think just so powerful, recognizing implicit bias, becoming aware of implicit racial bias. Ultimately, that can create what we need, an avenue for addressing those issues, because you can't change what you're not aware of. Every single presentation this morning has been just so enriching and valuable. So just thank you. I'd like to introduce now Richard Lewis. We're going to modify our time a little bit from 12 to 12:20 to allow Mr. Lewis to present and move forward. Richard Lewis is currently a mobile crisis peer support specialist with the affiliated Sante Group. He is also the owner of R.A. Lewis Consulting, LLC. However, in 1996, he was convicted as a drug kingpin. He was sentenced to 25 years in prison. He was raised in Kent County, Maryland on good values and morals. He excelled in school, went on to attend Goldie Beacon College. But as the crack epidemic of the late 80s and 90s started to expand, Kent County was no exception. He found himself caught up in the get rich quick, make easy money side of the community crisis. Unfortunately, this meant not being in the lives of his two children because of the prison sentence. Since his return to the community in 2015, he has been blessed to obtain gainful employment, renew relationships with his children, and be a positive contributor to our community. It's my pleasure to welcome Richard Lewis, whose presentation title is I'm Home, Now What? Thank you.
Good afternoon, everybody. I was sitting here and listening to this conference, and I never even thought, because I've done this several times, that I'd be actually triggered by some of the stuff that has been said, and my hands are cold and clammy right now. I'm like, what in the world is going on? I never really felt like this before. I am a product of this complete sin. I've been through it, every single intercept, and I've made it through. Part of my story that I really wasn't planning on going into, because I knew how deep this was going to get. But this has really been a blessing for me, because the impact of racial disparities, nobody never talked about that, you know. And the more nothing changes, you know. For me, the situation that I was in, I can't blame it on anybody else. I did that to myself, going to prison and doing whatever. But I'm here today to speak on reentry and a little bit of my story and how I got here and all about it. As far as each intercept, like I said, I've done every last one of them, and every presentation with the PowerPoints is on point. I've done almost 15 years in prison, and the reason why I'm here today is more or less different than others is family support. I've had a support system that's stronger than a lot of others may not have had. You know, there's things that I was afforded to that maybe some didn't, but the trauma that I never even thought about, the mental health, the substance abuse, substance use. A lot of guys coming in and out of prison, when they get on, they don't know how to navigate. You know, they've been through the system so much. A lot of you did not know it or not. Prison systems are the biggest mental health institutions in the state. If you look out your window, a pill call on a prison compound in the morning, you wouldn't believe how many hundreds of people is going to get some kind of mental health meds or HIV meds or stuff like that. It's when you see it, you don't really think about it, but it's there, you know. As far as reentry goes, we have needs, we have challenges, and how can we help? Almost everything that I was going to speak on, there have been PowerPoints. The lady from Talbot, she was right on point with everything that needed to be said. I'm going to touch on a couple of things, but as far as the racial disparities and things, I am a product of that. I'm the first and only kingpin conviction in Kent County. I'm from Chestertown. There's probably only 3,000 people, 3,000, 5,000 people in Chestertown. There's no way you can be a drug kingpin in a town that small. My lawyer said I wasn't a kingpin. I was a diaper pin at the time. But it was all about making names for different people. I'm not going to take away from what I was doing, because had I not been doing what I was doing, I wouldn't have been in that situation. Just like Warden Scott had mentioned before about him being pulled over several times. And I was pulled over several times too, but my situation was difficult. A lot of the times I was pulled over because of what I was doing. Same situation, guns in your face and all that. But for me, in the 90s compared to now, the racial disparities, the one thing is nobody has talked about is the disparities in the crack epidemic and the opioid epidemic. When I was coming through, they was building prisons and handing out time like their mind was going bad. Today, everybody gets treatment. You can go to treatment 5, 6, 7, 8 times. They even invented new courts, drug courts. For the same things that I've seen guys go to prison for 20 years for one rock for, guys now, they got drug courts, and you basically, even with the job I have now, you can turn your drugs in safe stations and don't get no time. And believe it or not, I agree with all that. I think everybody should have the opportunity to get treatment. But in 1996, when I got sentenced, it was a group of like 5 of us who was given over maybe 250 to 300 years for drug charges with no violence. None whatsoever. I've seen people with the same charges nowadays. They got drug court and they're getting treatment over and over again. It's the same people going to treatment 9, 10 times over. They can technically probably can teach the class, but my thing about that is, where was that money at back then when we needed it? The crack people in the crack epidemic, they needed treatment too, but they was going to prison. I'm definitely a product of that. I've seen it every day. Somebody that's trying to get high, sell a rock to somebody who said they got it from this guy, and they give him 25 years in prison. It happened on a weekly basis back in the 90s. And now it's opioid money everywhere. They got, and technically I'm kind of glad about it, because it gives me the opportunity to have the job I have today. You know, I'm a peer recovery specialist. My job is, well, right now I work in the crisis field, but I started out at the health department working at addictions and mental health. So I've been on the end where I've taken guys from the detention center to treatment, or from the detention, or picking them up from treatment back and forth. And it's definitely needed. I'm definitely not disparaging anything about the opioid epidemic, but that going purple thing really rubs me the wrong way. Because, like I said, this whole thing, when you're talking about the jails and the prisons and stuff like that, I did 15 years behind that wall. I can probably count on my hands how many times I had a fight. I ain't never shot a gun or done nothing. What I was doing was wrong. I always knew that, you know. That was never been the problem, you know. But when I was sentenced, the sheriff's department brought in all kids. The whole sheriff's department lined up in the dress blues all around the courtroom, just so they could see Richard Lewis get his time. They'd never done that before in nobody else's case. Sheriff Price himself came and picked me up from my apartment. I sat in the front seat of his sheriff's car, handcuffed in the front. I don't know anybody else that happened to. The bond situation, I was put on no bond. Then I was given a $500,000 bond. I'm like, who's dead? Who have I killed? I never sold any drugs to any kids. But like I said, I put myself in that situation. I knew what I was doing. I knew it was wrong, and I knew I was going to jail, but I didn't know they was going to make a whole spectacle out of it. And considering now the same crimes that are being committed these kids are getting nothing, man. These people are getting, sometimes, believe it or not, you need to go to jail to face those consequences. So maybe you do have the opportunity to change. Some people need to feel their door closed behind them so they can understand it's not cool just keep doing the same thing over and over and over again. So to the reentry part, man, there's a lot of barriers. The lady from Tablet was talking about getting your social security card, getting your birth certificate and ID. And a lot of guys don't have that. And it's, for guys coming home, it shouldn't be no barrier to that. You should be able to get your social security card, your ID, your birth certificate before you release. All those type of things should be done to help make it easy transition, you know. Definitely peer support, mental health peer support, peer support with real mentors, because when guys come home and they face those drawbacks where they can't get this and they can't get that, those give you triggers and they go back to them same neighborhoods because they don't have that family support, and it can drive them back to the same thing. But it's easy steps for me. You hear the cliches all the time, change people, places, and things, because you have to participate in your own rescue. I can't just keep blaming it on the town or the county or this and that. You have to want to change. You won't actually want to make that change actually before you get out of prison. And that's only going to help yourself on your re-entry way to get out. People see you trying to help yourself, they will help you. Because a lot of people like Warden Dennis, you done burnt a lot of bridges, going back and forth 5, 6, 7, 8 times. But you have to be able to show that you are a different person, that you want different. One of the key things we need some type of education, because a lot of guys that's coming home from prison, they don't have the skill set. They don't have the education. Some of them don't even have GEDs. And they need to get that, you know. Like I said, I have the experience and knowledge because I've been there. And I've also been lucky. I was lucky because I had people behind me, and like I put it, I was brought up a certain way. I knew better from the start anyway. You know what I'm saying? So I was kind of ahead of the game. I was always a bright kid, you know, but I didn't know what I know now, as far, especially working in the field, as the trauma. Some of my best friends that I have now are guys that I was locked up with who served long-term prison sentences. And it's not easy adjusting, you know. Some of these guys are just coming home and the first time they're ever seeing a cell phone. And that's difficult, you know what I'm saying? That's very difficult, but maintaining employment is key to reentry. Some type of education. I like the thing Warden Dennis was saying about the flagging, trying to get your driver's license for CDLs and stuff like that. But what is key, one of the things that they was talking about, the CIT, I speak to CIT, Crisis Intervention Team, that mental health first aid, I think that should be given to guys that just coming home, because that can help them out a lot, because a lot of guys have substance use issues. They use them while they're in the joint, while they're in prison, because it's not just the prison trauma they still dealing with trauma that ended up having them use drugs and getting them in prison in the first place. It's so much, man, but it's so much more that we can do. I think support and being around guys that are positive, because that can help another brother, not meaning that the same way I did it's going to work for the next man, but being able to be around a group of men or women that will just listen and understand, to be able to put you in the right position to transition home. A lot of guys have no clue about any type of financial literacy. And for a guy coming home, man, some type of sustainable housing and at least having some kind of strings attached where you can only be there for 6 months or something, because our guys ain't never had their own, you know. I'm not gonna hold you guys up anymore any longer because I know it's time. But it's like everybody was saying, we've had these conversations, then after this conference, what happens next? I mean, I'm always here to talk because, like I said, I've been through this whole sin. Like I said, I've done over 15 years in prison, but I've been on the outside and I've worked in this field. I've been in this field deep. I've done panels at state senate. I've been on all different conferences, and man, hey, I've trained CEOs. I was a housing clerk for 6 years, so I know how pretty much everything goes on each side of it. But thank you guys for having me, and that's it.
Hear the clapping in the background in your own house, Mr. Richard. Richard, I am so proud of you. Oh my gosh, you got me. I'm all goosebumps over here, sweating a little bit. I'm like you. Would you say your hands were sweaty? I've been in here. I think the carpet in this office is bald now because I done walked it out all day long. I'm just walking back and forth, just pacing. Look, Warden Cook laughing at me, but I'm telling y'all, this carpet is no good. Katie gonna have to replace it now. So the next presentation is Intercept 5, and I'm sitting here with Marquise, and he's going to be the next speaker. So Marquise Bryson hails from Baltimore, Maryland, and Marquise says, I was incarcerated for a large duration of my life, and today I'm among the correct path. Growing up, I was fatherless primarily because of a vicious cycle that exists within the inner city of every state. My father was incarcerated throughout my entire life, which created an anxiety and aggression and fear of the circumstances that were laid out before me. But on the bright side, I've had positive role models that filled the void of my biological extension not being around during those delicate years. I wouldn't say that my history was filled with grief, he's saying, and disappointment, because I consider my options that were later presented in my life as an optimistic opportunity. He feels that he views his life from a standpoint of the glass half full. He said his life kind of reminds him of the whole premise / origin of the legendary screenplay, The Wizard of Oz. He said he's had some personal components to help me along the way to get where I am today. And I wouldn't say that I'm a success story, humbly, because there's always room for improvement. And something about this line right here just gets me. He said, an old timer once told me that the minute that you begin to believe your own hype is the beginning of the end. And that's why he continuously strives to make efforts to exceed, plateau, and transcend. He's very excited to have worked with Ms. for Behavioral Health. And he's excited to be here today. And he wants to let everyone know that he's excited to present. And I'm going to slide over and let him go ahead and do his presentation. So Marquise, you are up. Slide out your way, sir.
Okay. Good afternoon, good people. I really appreciate the opportunity of being on this panel and being a part of this discussion. I'm gonna start from the beginning. I'm from Baltimore City. My father got incarcerated for a second-degree murder when I was young. I never knew him, I never met him. My mother and I, we was living in the projects. My mother, she was a very gorgeous woman. And she was very humble and a very loving person. She got hooked up with the wrong crowd. So my mom started indulging in heroin. And I have a recollection of that since I was about maybe the age of 7. And when her abuse started escalating, she'd be gone for like days at a time. So when I used to go to school, I get out of school at like 3 p.m. I used to have to climb through the window and let myself in. And I used to make my little meals, Denny more beef stew, my little cereal and stuff like that, like Dig'em Smacks and Cocoa Puffs and so forth. By the time the night fell, we didn't have no lights in the house because we were struggling. So I remember I had a green and white Hess truck, Hess. It was white and green. And I put my little batteries in it that I used to have to keep putting in the freezer just to recharge them. And the lights would help me navigate around a dark apartment in the projects. By the time the neighbors found out that I was in the apartment for 2 or 3 days, they'd call my grandparents. My grandparents would come up that hill, come around that bend. My grandfather had a red and white camper, like a trailer. And I used to feel like I was being rescued. I go back to West Baltimore with my grandmother and grandfather, and they took me in, was raising me. Then once my mother got on her feet, I go back and move with her again. She'll relapse, so on and so forth. April the 19th, 1992, on Easter Sunday, my mom, she passed away in my arms, right? And that was my biggest fear. And any man know that was a mama's boy, that your mother's your first love, right? So when that happened, it made me more bitter. It made me bitter because my father wasn't around. So I hit the streets with a vengeance. I was always a quiet, laid back guy. And for some reason, a lot of the younger children in the inner city used to hate on me to a degree. And, you know, I heard things like, oh man, you're not built like that. You're a pretty boy, this, that, and the third. And they used to insist to fight me. So I used to try to be a gentleman in savagery land, which didn't work. So I would let the individuals take their jacket off if they wanted to fight. But when I used to try to take my jacket off, they'll rush me. So then I started learning that I can't play by the rules. Fast forward a year after my mother passed away, I wouldn't say I was a successful drug dealer because I think that's oxymoron. I, reached the pinnacle for the age that I was doing wrong. So long story short, drama come along with living that kind of life. I got incarcerated in my late teens. I received a 35-year prison sentence, right? So when I went into the system, I had it in my mind already that I'm not looking for any problems in there, but I'm not going for anything. Lo and behold, God had his hand on me the whole time because he sent me in a Maryland penitentiary where my uncle was housed at. Now, mind you, my uncle was a lifer. He was locked up since 1980. May the grace be, the glory be to God that my uncle was released last year. Long story short, when I came into the system, the old heads, they was the majority. And us younger guys, we was the minority. So I couldn't rip and run in the penitentiary. Maryland House Correction Annex, Maryland House Correction, and so on and so forth. The old timers used to make us go to school. And once I got my diploma while I was incarcerated, my uncle used to give me these books. He used to open my mind up to reading authors like Leonardo da Vinci, Dante, Plato, Socrates, Baldassar Gracian, Stephen Covey, the philosophies and opinions of Marcus Garvey, Malcolm X, George Jackson, Jonathan Jackson, countless authors. And that was very fundamental in my growth, but it still wasn't my season yet. So it took me around 8.5 years ago for parole. And being as though I only had 8.5 in on 35 years with parole, I wasn't denied parole, but I was given, they gave me a hit. They said they'd come back to see me in 10 years because they wanted me to really put a dent in my time. So when I came back 10 years later, my adjustment record in the system was terrible. I never used to start problems in there, but you have a lot of predators that's in there. And if you show any sign of weakness, then you'll get extorted and a lot of other problems will come your way. So mind you, I got into an altercation with an individual, and this had to have been anywhere around 2003. So at that time, I was locked up maybe 10 years or so. They sent me to this like maximum security aspect of the institution to do my time. I didn't have any cell buddies, no cellmates. And if I looked out the small foggy glass that was mounted on the door, I couldn't see any inmates across from me. So my uncle got up the next morning and typed me a letter. He told me about the story of an individual by the name of Dr. Victor E. Frankl. Dr. Frankl was born in 1905. And he was in prison in Auschwitz, which was in Nazi Germany. He lost his mother, his brother, and his father. Only person that survived during the Holocaust was one of his sisters. So Dr. Frankl, he specialized in logotherapy, which is an extension of Freudian psychology. And Dr. Frankl found himself naked and alone in a small holding area. And he found something that he later described as the last of the human freedoms. And the last of the human freedoms he quoted was, man or woman has the ultimate power to choose the way that they allow a situation to affect them. He said, in between stimulus, where something began, and in between response, smack dead in the middle, you had the power to choose the way you allow a situation to affect you. So my uncle was telling me the story about this guy in a letter that he typed me. This guy was small in stature. He come from another side of the world. We have different ethnicity, race, and everything. But as I was reading his story, I felt like he was my brother from another mother. Dr. Frankl, his gift was allowing people to find meaning in their very own suffering. Not only was he an inspiration to the other inmates that was locked up in a concentration camp, he was even an inspiration to the SSs, which were the correctional officers. They had more freedom than him when it come to physicality, but he had more liberty. Dr. Frankl had the ability to use his mind's eye to picture outcomes, and that'll open up a door that will lead to something else. This guy was very positive. Anyway, Hitler used to get the Jewish people up in the morning before the sun rose in the morning, and had them walk on miles and miles on an expedition through the snow. Some people had shoes, some people didn't have shoes. Some people had boots that had holes in it. So I'm gonna rewind for a minute. Dr. Frankl, his wife, and his children were separated as soon as the Nazis seized them. So Dr. Frankl's wife said, if I don't survive this, if God allow me to, I'm gonna come back and give you a sign. And he said, don't speak like this. Our people are very resilient. We're going to overcome this. So I'm gonna fast forward years later. Dr. Frankl was going on an expedition through the snow. And once he made it to his destination, he stuck the shovel down in the snow, and he was just observing nature while the correctional officers and the other inmates were maybe 10, 15 yards away. He said he started reflecting on his wife. And he said, as he was looking up at the sky, he noticed there was a tree that was planted right there. It didn't have any leaves on it. He said it was a bird in the tree. And he said the bird flew down and landed right on the top of the stick of the shovel. He said he just kept thinking about his wife. He said, today was his wife's birthday. And he said, at that moment, I knew my wife was deceased. He said, because today was our birthday and birds was our favorite creature. And it had tears balling down my eyes. So as America, I think it was America, Great Britain, and another country liberated the Jewish people and invaded front lines, Dr. Frankel used to always envision himself giving lectures at prestigious colleges. So when he got liberated from the death camps, he gave a lecture. And this young lady raised her hand and said, Dr. Frankel, could I ask you a question? He said, you may. She said, if you don't mind me asking, she said, why did you translate this book? She said, first and foremost, your book was very riveting. She said, but why would you translate it in German language when they was the very people that try to eradicate your race of people? So he said, before I answer that question, let me ask you a question. He said, do you own a butcher knife in your kitchen? She said, yes, sir, I do. He put his hands to his mouth like he was shocked and said, how can you own a butcher knife in your kitchen when murderers dismember people's bodies with it? So that was an aha moment for him. So he went on and said, you cannot allow the actions of a few to hinder the entire, body of everybody, right? You can't. So Dr. Frankel said, I love America. And he said, y'all have a Statue of Liberty on the East Coast, but I propose that y'all make a Statue of Responsibility on the West Coast. So I said to myself, this man changed my life so much. I said, if I ever come into a nice amount of money and I'm able to change something, I would like to bring that into fruition. And a statue that I could envision is a man with his arm around his woman and his child in his other arm. And I think that's the perfect, I think that exemplifies the statue of responsibility. And when I finally got off a lockup from the altercation that I had, I got off like 5 months later. I ran up to my uncle and I hugged him. I said, man, thank you for that letter. And some kind of way, my uncle managed to get the book back to lockup to me. And inmates weren't allowed on this high security lockup. He said, I've been had that book for you. He said, but it wasn't your season. My uncle is such an intelligent man that I can recall sessions where he was instilling confidence in me and grooming me. And I had no idea of the profound effect in what was taking place in my life. One particular day, we was in a rec hall in an institution in Jessup, and it was raining outside. We was about to go out to the recreation yard and exercise, 8 o'clock in the morning. So it was around 3 or 4 of us standing by the window. So a younger man came over and said, excuse me, Mr. Bobby, I can't see out there. How I look outside? Is it nice out there? My uncle said, oh yeah, it's beautiful out there. Absolutely gorgeous. So the young man came back 2 minutes later and said, Mr. Bobby, it's pouring down raining out there. He said, yeah, I know, exactly. He said, proactive people take their weather with them wherever they go. They have internal. He said, and I used to ask my uncle, what do proactive mean? He said, you taking full responsibility of your life. And he told me this. He said, man, I said, so what you trying to tell me is that, I said, I never see you get upset like I may get upset. He said, nobody can make me upset. I said, nobody can make you upset. He said, no. And I couldn't understand it. He said, the same way you choose to be upset, you could choose to be happy. And this guy, he used to always, my uncle, he just like, and that's how the old timers were back during that time. But when I was leaving the system in 2018, when I got out, I noticed that the population has dramatically changed. Now, the old timers are like 10 or 15%. And I'm gonna say at least over 70% of the population is younger guys. And these are people that come from the same environments that I come from. And my uncle seen something in me that I didn't see in myself. He used to always keep calling me a leader. And I used to keep looking around and say, man, like it made me feel uncomfortable because I know with leadership come responsibility. I didn't want that kind of, he said, man, whenever I see you with all of these guys that you with, you the leader out of all of them. And that made me feel uncomfortable. And as I start progressing and growing into myself, I start realizing that people would always come to me for certain answers. And I had an effect on people's lives, like Dr. Frankel. Dr. Frankel was the kind of individual where people was trying to get from one moment to the next. And he was showing them meaning in their very own suffering. But some people's spirits were broken to the degree that even Dr. Frankel couldn't save them. They'll run out of line, out of formation, and the SSs will shoot them down. So this guy, 2 men, I done read stories about biblical figures. I done read about Malcolm X. I done read about all the great African warrior Hannibal. I read about Napoleon Bonaparte, so on and so forth. But Dr. Frankel and my uncle, these are 2 men that I give credit for my growth and development. And as far as the institutions are concerned, because I know that it's wardens and correctional officer staff that's participating in this event. Something that I highly encourage and I suggest is that I know it's programs in there like Thinking for a Change, NAAA, what was the other one? It's a lot of them in there. But if y'all come up with programs like you can have people in different aspects of the institutions or in the dormitories, people that's of sound mind and body, and they have proven that they have good character, for them to start like programs on teaching men to become, or teaching males to become men, because that's something that a lot of us are lacking. And my grandmother, the woman that's responsible for raising me, all she kept telling family members and friends is that she wanted to be alive when I got out. She used to always tell me, stop calling them guys your friends, they're your associates. You're gonna find out. And I used to always say, they're my friend. But when I got locked up for all that time, my grandmother didn't care who was sending me money orders to the institutions or not. That lady will send me $100 or more every month to keep money on my books. And when I finally got out, and the month was August, my grandmother went into the hospital during that month, but I was able to make peace with her. And she seen me get out and she seen me thrive. And I showed her my bank card. I showed her pictures of me at work. And then she knew I was doing the right thing. Cause I used to tell her on the telephone like everybody else, when I get out, I'm not gonna hustle no more. I'm done with that. She said, I don't wanna hear it. She said, don't talk about it. Just prove it to me when you get out. And when I got out, I made peace with her. She seen I was doing the right thing. I left Baltimore and I came back to the area that I reside in today. I got a call from one of my family members and I knew what it was. It was on a Friday that my grandmother had passed. And just the day before, on a Thursday, I got my license in the mail because I left outstanding tickets and everything when I left the street. And she didn't get a chance to see where I'm at today, but I know that, I know that she's well aware of me striving. And as I tell everybody that listen to my story, right? And everybody that listen to my story is that, it's always room for improvement. And as I said in my bio, that the minute you begin to believe your own hype, that's like the beginning of the end. And I'm gonna tell you all this before I go. I had so much anger in me, especially when I was incarcerated in Hagerstown, Maryland, because of the racial disparities and everything, right? And God sent this older European man in my life by the name of John McCormick. He was the laundry man. John used to always tell me, say, Keith, man, you got to let some of that anger subside, man. You're a good guy, man. But he said, man, either you drink that milk or you throw it away. Because if you hold on to it, it's going to fester in you, man. It's going to rot and decay. So long story short, John was coming out one day to pick up the laundry on the tier, and he collapsed. Somebody caught him. They shipped him, they flew him down to shock trauma in Baltimore, and he passed away on the table. And everybody kept saying, Keith, man, that was your dude, man. You got to put something in the institutional newsletter to commemorate him. So I wrote a poem that was called Dear John. Instead of the poem being about a lady that left a man, Dear John was an ode to a friend. And the poem went, Dear John, as I write this letter, please wipe away my tears. Innumerable indignities I've suffered through the years. Overwhelmed with confusion. Will I make it to the gate? I'm held in seclusion until I learn from my mistakes. Timeless jewels were given from older men with wisdom. Destroying family ties is the structure of the system. Cordial conversations trying to dwindle down the pain. Compassion in his heart because he's going through the same. I love you. We were brothers, despite our creed or color. The tears not the same since you left to join my mother. Glancing out my window, a sudden storm of hurt. Rainbow in the sky seemed to vanish from the earth. Never question God. I know his will is best. Accepting death is hard. I'm a convict in distress. So the name of that poem was actually Convict in Distress, but in parentheses, I put Dear John. And what I would like to tell a lot of the people that's in power positions that can help people is never pass judgment on a book. Because you can have a Tiffany box and open it up and it could be a piece of manure or something that's in it. But then again, you can have a book that the bind is loose, the thread and everything, and it's falling out of it, but it could just be precious, right? So invest in people, and it's deeper than a financial contribution. Sometimes people just want to know that people care, right? And everything that I went through in my life, 25 years of incarceration, and I'm back out here. I'm out here now. I have a decent living, nice paying job. I've been home since 2018. I had like about 5 vehicles. I'm shopping right now to try to buy a home. And I would like to say thank you to all the men that helped me along the way, just like the Tin Man, the Cowardly Lion, the Scarecrow, and all of them helped Dorothy along her way when she was in Oz, right? And I would like to immortalize through this segment, Mr. Johnny Grimes, because that's my uncle, and he's a very, one word to describe him, he's a very regal / Renaissance man. And he's an unsung hero. The prison system, Baltimore City, so on and so forth, it's a lot of positivity that's in those places, but it's overshadowed by the negative aspect. You got people in Baltimore City that's homeowners, never cheated on their spouse, pay their taxes, and involved in all kind of community reach programs, but they're being overlooked and it's being overshadowed by the negative aspect. And the same thing with the system. It's a lot of people doing a lot of good in there, and integrity. Someone that adheres to a strict ethical code that's unwavering, right? Always do the right thing. A brother named Rashid used to tell me, Marquise, it's not about being right, it's about doing what's right. So I would like to say thank y'all for y'all time. I've taken up enough. I would like to thank everybody that spoke, especially Miss Omika. That had me, I was about to cry in here. And I'm a masculine, strong man, but I'm human. And thank y'all for your time, and keep paying it forward. The same way how somebody will pay for your coffee right in front of you, pay it forward. pay for the next person coffee that's behind you, not just in a literal sense, but figuratively. I love all of y'all. Everybody that's participating in this are very unselfish people, because you got 3 stages in life: dependent, independent, and interdependency. We all are interdependent because we coming together for a cause that's greater than ourselves as individuals. Thank y'all, and peace.
Thank you so much, Marquise. Oh my goodness. Oh, so inspiring. Emotions, tears, goosebumps. Wow. And much needed. I think, how about, with that being said, with the segue, we take a 5-minute much needed regroup break, walk around, take care of ourselves, and reconvene in 5 minutes with time 10 of. And we will then go to the question and answer with the wardens panel, if all's okay with that. Thank you. All right. Welcome back. At this time, I would also like to reintroduce some of the wardens and directors for our question and answer panel. So Lamont Cook, who you have met, he's the director of Queen Anne's County Department of Corrections, and he's been there since 1987. He was former chief deputy at the Kent County Sheriff's Office after appointment as deputy in 1975. He has over 47 years in criminal justice and government service. He also is vice chairman on the Maryland Police and Correctional Training Commission, director on the board of directors of the People's Bank of Kent County, director of board of directors, Maryland Capital Enterprise, member of editorial advisory board of the African American Pride magazine, member of Maryland Association of Counties Conference Planning Committee, legislative co-chair for Maryland Correctional Administrators Association, He's also a member of the board of directors of the Midshore Council of Family Violence. And Kenny Rogers, he has spent his career working in corrections. He retired from Caroline County Detention Center after working there for 30 years. In 2018, Kenny Rogers began a new career at Dorchester County Detention Center as Lieutenant of Classifications. In 2019, he was promoted to Captain in charge of Training and Standards Coordinator. In September of 2021, he was offered acting director and appointed director in November of 2021. It's my pleasure to have them all here, as it's been for everyone so far. Such a powerful morning. And we have been taking some questions and moderating throughout the morning. And one of the, just as we compile some questions together for the wardens, one of the questions that came up was, what is a warden and what does a warden do? So I think maybe we might want to start there with some of you. You know, that was a question. So folks want to know what is a warden responsible for, and what's the difference between warden and director?
Well, I'll start off with it. Let me just say this briefly before I get into that explanation. Every county in the state of Maryland has a correctional operation at the local level. They are the receiving point for anyone that has been placed on a bond, no bond status, when they're sentenced locally, when they're sentenced to the state, that's the location where they'll stay until they're transferred to the state. And that's generally what the operations are for. There's more to it because we talked about programs that was presented by Talbot County's person there. And a warden and a director, I guess in a way, are about the same thing. Directors are used more so in later years as far as that, compared to a warden, but they essentially the same thing. Some facilities go, or the counties recognize them as wardens, others as directors. A correctional facility at the local level is an adult detention facility, and people are held there on various levels of incarceration. They're on bond, they're on no bond status. Some are sentenced locally. As I said before, some will be held there until they're transferred to the state Division of Corrections. And you heard the young man talk about his experience there. But primarily that's what we do. We are part of the judicial system. We're part of law enforcement. We directly work with the courts. We work with the state's attorney's office. We work with the various police agencies, sheriff's department, state police, natural resource police, local police. We're all united together in that operation. So we operate with the courts to hold individuals pre-trial, sentenced, and some awaiting transfer to not just the state, but we hold sometime. I have a gentleman coming in from Delaware on a case that he had to go to that state and take care of. Now he's coming back to finish the sentence with us.
Thank you. Anyone else want to chime in, the wardens?
No, I think Lamont summed that up pretty good for everybody. The biggest thing is for all of us is that it's just the preference of the county what title they actually give you. In Kent County, they say warden, but honestly, everybody's a director. We wear many hats. We're inside the facility trying to change people's lives so they won't come back to the detention centers. But in the county facility, it's a wide margin because we're getting people on pretrial who might not go to prison. Just in the prison system, they're dealing with people who have been sentenced, who deal with different kinds of laws and different things that you can actually do to a person, because we're dealing with people who have maybe not be found guilty. They just been charged with a crime. They haven't been to court yet.